And Superintendent, then Deputy Secretary, now Superintendent Gullickson, has been representing our office at all these. And so I'm really tickled pink that I get to spend the day with you all today, because this issue is near and dear to my heart as a mom, as someone who used childcare in Virginia, and someone who believes deeply. And in my career, I actually started my career, if you were here in that first session, might remember that one of the first things I ever did in my career was to help run a governor's task force for NGA on school readiness with Governor Voinovich, where the business community and governors came together to make recommendations for governors around how do we strengthen childcare and to make sure that it was all about school readiness. And so it means so much to me that Virginia is now leading the nation in this effort. And so thank you to you all for what you're doing for the business community, for educators, for our legislators to be here and to make sure with this commission, and many thanks to Delegate Coiner for her leadership in making this commission possible, and Kathy for being part of all this with VECF. But making sure that there is a body of Virginia stakeholders who are thinking all the time about how do we ensure that Virginia continues to have the country's best public-private choice childcare system and education system in the nation. So kudos to you, and thank you for your service and your commitment, because it matters so, so much. I just wanted to level set, because I know we have a really great agenda today and lots of folks speaking, but just to kind of give a global view of where we are. And in the governor's office right now, we're doing a lot of thinking about, so what just happened the last 4 years? What's the from, what's the to, where are we now? And there's so much goodness that has happened in the last 4 years here, but that those 4 years really built on so much work that had been done in the foundation before the Youngkin administration came in, and it will continue after we're gone. And that to me is part of the really important part of this commission, to make sure that there's a body that continues to prioritize and make sure that our elected and appointed officials also are making this a priority, and that this has to be a partnership between the business community, citizens, and government. And that's what makes our program so, so wonderful. It is public-private, and it is meeting the needs of families across the Commonwealth and the needs of workers and employers across the Commonwealth. So thank you. So I am going to approach this not just as a mom, but also the daughter of an economist. Apologies to those of you who heard me say this last week when we had our great announcement, but I took Econ 101 and did not follow my father's PhD economics footsteps, did not do so great in it, but I do remember 3 critical things I learned at our dinner table conversations about the effectiveness of markets. And what we've basically done in Virginia, what you all have helped do, is to create a marketplace that works and serves families and serves children. And the 3 components of any market working are ensuring that there's high quality options, that there's high quality resources, dollars, and that there is high quality information to fuel that marketplace. And I would claim that is why Virginia is winning, and why we are serving more students than ever before, and why we continue to lead the nation, is because we have built a market that actually works for families. And I wanted to spend a couple minutes highlighting some of those wins as we level set and go into this conversation and talk about how do we continue to build on this. So first of all, about the options. I want to draw attention to an incredible event that happened last Tuesday. Some of you were there. That was celebrating the release, the second annual release of our quality ratings out of the VQB5, which I never can say well, and I'm sure I transposed some letters or numbers together. But basically, our commitment to quality and quality ratings in Virginia. And it's extraordinary. I'm going to look at my paper for the exact numbers, but 31,000 observations were done this past year. And Jenna, who I don't think is here yet, but had said, no way could anyone do this. When they announced, when the VDOE said we're going to do these quality ratings, it's like, you can't do that. It's not possible. And Virginia did it. And it matters, right? This sense of quality and ensuring that parents can trust the places that they are dropping off their children. And we know that trust is the most important attribute to healthy relationships. And this is what it is when parents in Virginia can trust where they are leaving their children, when they can go to work, makes a huge difference in people's lives. I know we'll be talking about some data today that will reinforce that. What we know is that now we raised up and get the exact numbers that we have improved in terms of the quality of those ratings. Now we know where every single center is. But most importantly, based on last year's ratings, we were able to then also provide supports to address places where there may be deficiencies or places that there need to be strengthening. And the news is great, right? We know this. When we set high expectations, we're clear about those expectations. We understand the needs and we provide the supports and training. Our centers and people in general just get better. It's like, tell me where I am, tell me what excellence looks like, and then provide the support so I can make those improvements. And that's what the story is, that our centers got better. And so what's extraordinary is that we had a 28% increase last year in terms of exemplars. And we had 500, 15% of our centers now are in the exemplary meets expectation, above meets expectations in terms of the quality levels. And I think, Elliot, correct me, some of the BDO team, 95% of our centers are all at the meets expectations, exceeds expectations, which is extraordinary. And what this is a statement of quality matters. And this entire system and our relationship with families is based on high quality and our commitment to high quality in Virginia. And that changes everything. So that's the first part of markets working. The second piece is access to quality information. And this is something near and dear to me as somebody who ran and I started a nonprofit and ran an effort called the Data Quality Campaign, is that how do we change the role of information as a tool of improvement, a tool of transparency, and a tool of empowerment, which is what this is right now for our parents, but also for our directors of our centers, our family homes, is to make sure they have the information that they need to make sure that they know exactly what they need to do differently, and that you all, and many of you as policymakers, understand where we need to put our resources and prioritize our resources to the places that need the most support. And so two pieces on this. One, and again, this is where Virginia is leading, is one, the launch of the Parent Navigator site in October 2024 now provides access to anyone. I hope everyone has looked at this website. It is extraordinary. And we've had over 100,000 views of these sites. And if you haven't looked at it, please do so, because when you go, you can find all of the options and all of the information on the background, the quality, the information, the hours, the people running it, so that families can make informed decisions about where they want their children to be during the day. And as a parent, and you might recall, I told a story about our nanny when we were living up in Fairfax being fired, and the panic that ensued for my husband and me of what do we do? I'm not sure I can trust anybody again after having my nanny fired with my child in the stroller, which is another whole story over a glass of wine. I remember sitting on the couch and saying, I'm not sure I can ever go back to work again because I'm not sure I ever will feel safe leaving my child. Had I had this website where I could go look at all the options within 20 miles and also understand the quality ratings and what was happening, it would have changed everything. As it was, I found a great family home center that Fairfax County was running, and it worked out terrifically. Everything's great. I kept on with my career. My child is great, all of that. But boy, would this website have changed how I made my decision, but also really built my trust in the system working and my child being safe. So this is just a game changer for Virginians. But the other piece that Virginia is doing that's just changing the entire sector is now we have the ability with the new VA Connects for our early childhood data system, which is one of the best in the nation, to now connect with our K-12 data system. And what this will provide is the ability to show the return on investment. What happens when our children are going and having quality care? And what does that do to connect with literacy, on-time literacy, and having all of our children reading on grade level by third grade? What does it do for math competency? What does it do for social and emotional development? We will now have this information in a way that it will be able to make the case for the ROI, which you're on this commission, you believe that there's an ROI for investing in early childhood. And we also will be able to see what works and how do we learn from what works and how do we do that. One of the best stories, just to connect this data piece to the first issue of quality options, is that our office kept getting phone calls last week because as part of the award, we recognized representing the 4 different approaches to childcare, 4 of the award winners of the 500. And it was a great celebration, and we gave out certificates, and all 500 are getting certificates and recognition. But we started getting phone calls from people saying, why wasn't I recognized? I would have been there. And to me, that says a whole lot, that people are hungry to be recognized for the improvements they've made and the excellence that they've reached. And so And what we also got calls about was saying, how do I learn from these 500 so I can become one of these 500 next year? This is the ecosystem of how do we use data to inform, to identify excellence, and then how do we replicate it, and how do we have people learn from each other, and how do we make sure we're always celebrating it? And then the second, and the other piece why I love that whole data piece is as part of my work at the Data Quality Campaign, and this is when I first met Elliot. In 2009, I think, Elliot, we launched the Early Childhood Data Collaborative, which had 10 essential elements of a quality early childhood care system. And one of the key pieces was the ability to connect early childhood data with the data in the K-12 system. So good for Virginia. And this is going to just reap incredible benefits for being able to make good policy, but also for people to make good decisions about children. And then the last piece is just having high quality dollars. And we know making sure that families have the ability to access these quality options. And so together with the General Assembly, the governor, with advocates, over 1.2 billion additional dollars has been put into the budget over the last 4 years to support families having these choices to go to high quality places. So this is working. And we cannot rest on our laurels because we need to keep doing this more and more and more. And our economy depends on it. Our quality of our education and outcomes depends on it, and supporting strong communities depends on it. And so this is my way of saying, thank you for being here. We cannot do this work without this commission, and that while we have a lot to celebrate and to say, well done, and we've done a really great job, everyone in here and the organizations and the populations that you represent, we have so much more that we need to do. And so that's my request of everyone, is to roll up their sleeves and do some celebrating, and at the same time say, what do we need to do to make sure that we are leading the nation? So I want to close with a thank you for two very specific people, and that is our co-chairs, David Bulova and Carrie Coyner, who have just been extraordinary champions in the General Assembly, but also leading this commission. And change and breaking the status quo requires strong leadership, and we have in these two leaders in our General Assembly. And so it is my pleasure to invite Delegate Coyner, our chair, to come and make some remarks and kick us off for the day. But thank you so much for being here, and I look forward to talking to people throughout the day. I could go me do attendance. Sorry, that was or someone on team do attendance. I'm going to give it to somebody fancy to do. All right.
Thank you. All right, good morning, everyone. All right. I will take care of attendance and then we will get going. For those of you who are on Zoom, as a reminder, please make sure that you unmute and tell us where you are joining us from. And everyone else, I think, is here in the room. As a reminder, restrooms are right out the door, past the elevators, down the hall. They provided a great sign, so it's easy to find. All right, Delegate David Bulova. Here. Delegate Ellen Campbell. Delegate Mike Cherry is going to be late. Delegate Carrie Coyner here. Delegate Cliff Hayes. Senator Adam Evan. Sure. Senator Mamie Locke. Senator William Stanley.
Here by Zoom in Franklin County.
Senator David Suederlein. Secretary Amy Gadara. Present. Secretary Brian Slater. Here. Kevin Erskine. Ashley Allen. Belinda Astrop. Jason L. Kuby. Thank you. Perfect. Appreciate that. Simon Fiscus.
Here, Madison,
Shakiba,
Virginia.
Thank you, Simon. Shakiba Frazier. Kathy Glazier. Here. Edmund Hughes. Kristen Kane. Erica Knowles. Here. Kayla LaFond.
Here virtually from Virginia Beach.
Thank you. Ken Nicely. We saw him. We know he's here.
Here from Roanoke County.
Todd Norris. Nicholas Palacio.
Here.
Stacy Parham.
Here.
Benita Petrella. Jenny Poor.
Here, Chesterfield.
John Saleh,
Here.
Travis Staten,
Here.
Gary Thompson, Kevin Waddles, Rachel Williams,
Here.
Elizabeth Winkle. All right, thank you, everybody. Thank you, Secretary Gadara, for welcoming us this morning. Over the course of the administration, you and Governor Youngkin have given us clear communication on the early childhood care and education system in Virginia. And we thank you for your leadership and all that you've done, and worked really hard through our nervousness over the possible federal cliff that was looming over us and historic investments that have been made. So thank you for so much for all the time that you've dedicated to our early childhood system. I'm going to be giving you to start our meeting with 2 updates because we cannot all participate on every work group. Maybe we could, but we wouldn't be doing anything else because we have been a very busy commission. So I'm going to go over some details, and then there are actually in your packets at your table details on the work of those work groups if you'd like to look over it during the meeting. And if you have questions, we can go through those later. The first packet that you have is on the out of school time work group. And so in the FY 25-26 biennial budget, we did have a request that we would review and recommend adjustments to CCSP reimbursement rates for school-age children and the appropriateness of continuing to provide services through that funding to school-age children. And our request was very detailed. If you remember, we received a letter with a request for us to look at that. And they wanted us to really look at how do we maximize dollars while ensuring parent choice? How do we quantify impact and return on investment? How do we strengthen the quality of after school and summer options? How do we identify out of school time deserts in the Commonwealth and develop innovative approaches to reduce those? And so our commission, we had representatives from school divisions, 21st Century Learning grantees, private childcare providers, the Virginia Partnership for Out of School Time, local parks and rec entities, YMCA, communities and schools, boys and girls clubs. The list goes on and on for individuals and organizations willing to participate in this important work. They were invited to the table, and they really looked at approaches to maximizing state and federal resources by adjusting income eligibility requirements to reflect regional cost of living variations. So the Virginia Department of Education facilitated 3 meetings of that work group between June and September to develop recommendations. And those were related to health and safety, quality, and access. So those were their 3 main topics if you look in your packet. Those 2 pages overviews that you have include 11 broad recommendations that were put forth by the work group. And so these recommendations, along with an extensive set of examples for how to approach those recommendations, so they gave us their recommendations and then some possibilities on how to do those, will be shared with the entire General Assembly as we continue to look for ways to strengthen the public-private out-of-school time system and maximize the resources that we have. So I would encourage you to take a look at that. And in particular, if you have feedback on how you see those recommendations intersecting with the work that we continue to do in the early child care and education space. The second work group that handled the issue of attendance, the budget asked the Virginia Department of Education to revise attendance requirements for the child care subsidy program and mixed delivery and Virginia Preschool Initiative. And that focus is, again, only in the birth to 5 space. So that was what was looked at. And so the department facilitated an attendance-focused commission work group on October 21st, 2022, if you remember. And then the members reviewed current attendance policies, learned about modernized attendance practices. And we actually, I hope some of you who were here remember, we had presentations on their recommendations and we gave our suggestions on what to do with attendance. So there's a lot of exciting news in this update of the work that we did. So first, we have seen improvements in the last year on attendance. So that's exciting to hear. They're highlighted in the 3-page overview that you have in your packet. And a big thanks in large part to this improvement are policy shifts that our group embraced and suggested. And we have seen great reductions in chronic absenteeism for both the child care subsidy program and VPI. Second, we are moving to that modernized attendance tracking system for the child care subsidy program as of December 1st. We think this will greatly improve and the improvements that we've already seen for tracking attendance, collecting data, and using that to further help us develop practices and policies to move attendance from good routines to great routines and therefore better outcomes for kids. So I would encourage you again, both of these documents are the result of work that we did over the past several years, recommendations that we previously made, and we asked smaller groups to continue working on. We would love to have your feedback as you read through the progress that's been made, if you think there are additional things that our larger body, the commission, needs to address. After those updates, I am going to hand it over to my co-chair, Delegate Bulova, for an update on work group activity for House Bill 2538, which was the establishment of a funding formula for the early childhood care and education system. Thanks, David.
All right, good morning, everybody. Excellent. Glad to be here. Thank you, Delegate Coiner, for getting us kicked off, and Secretary for your excellent remarks at the beginning. I have kind of the dual role of providing an update with respect to the work group on House Bill 2538, but also then to introduce our first morning panel. I am very glad to see Jenna Conway here because I know that she had to sprint from one meeting to this meeting. I was told that this was going to be my opportunity to filibuster in order to be able to stall and make up some time. So thank you for doing that extra step to go ahead and get over here. If the commission will recall, so at the last meeting, we provided an update on this work group, which talked about the funding formula. And so we did that at our September meeting, and that actually elicited a good amount of response, thoughtful response, and a lot of additional questions. And so we thought it was very important to follow up with the Department of Education, provide us some information and data, and do some presentations on two things. So the first one is illustrating the elements that drive the cost of early childhood care and education, and then second, quantify the impacts of inaction. And that way, it would help the commission to better visualize how that new funding model might work, right? And so we've tried to keep it relatively simple with respect to legislation, but we know that there's a lot more that goes on behind the scenes. And so we wanted to be able to illustrate that as well as also highlight the opportunity costs of not taking any action. And the reason why we wanted to pause and bring Jenna and her team, as well as folks from UVA in here, is because those are exactly the same kind of questions that the General Assembly is going to ask, right? And so sitting on Senate Finance and Appropriations or House Appropriations, those are the key issues that they're going to ask. You know, what is this going to look like? What are the things that are going to drive those numbers that we're going to be presented with? But ultimately, if we don't do anything, what's the opportunity cost that we're facing from that as well? So as noted at the last meeting, we are simultaneously trying to deal with three challenges. So the first one is, how do we address demand for services, which is demonstrated by the current wait list of over 14,000. We also have to think about the supply of quality services. And so that means ensuring that our early childhood care providers are adequately compensated. And then ultimately, how do we ensure that the system is nimble enough to address economic development opportunities and childcare deserts as those are identified. And so sticking with our three theme, because it's really easy to remember three things all in a row, that's how we came up with those three parts of that funding formula. And so just as a reminder, so that's parent demand, so what are the number of families with children under 6 with both parents in the workforce, and what are their preferred choices, right? And so it all comes down to, what will choose if given a choice. And that's driven a lot of our conversations, is that parental choice. Each family is unique, and we try to make sure that they are able to avail themselves of the best opportunity that fits their particular family. Per child cost. So what is the actual cost of providing high quality services per child based on parent choice? And so the General Assembly is often guilty of providing a percentage of the cost of things, or not really understanding what the cost is. And so in this case, Given where we are with early childhood care and education, this is a great opportunity to step back and say, what are those true costs of quality as we have created, developed, and implementing this system? And then finally, what additional funding is warranted to address economic development needs in areas where supply is limited, right? And so we've got a lot of great resources in BEDP and others. How do we synthesize that and turn that into a reasonable number that could go into a funding formula? During our work sessions, and so we had 4 of these work sessions, Jen and her team really did a tremendous job of helping us to understand what each of those elements mean in the real world and how they would feed into a model. And so no good deed goes unpunished. And so we wanted to re-invite her to be able to present those to the full group, because it really was very, very useful in terms of those details. And I think it's important for the whole group to understand what was driving, what was behind that. In addition to Jenna, we're also very pleased to have join us on our mini panel, Dr. Daphna Basak, who is a professor of education and public policy at the University of Virginia. And what her team will share are preliminary findings of a survey of families who are or who have been on the wait list for early childhood care and education services. So together, what we're hoping is that those 2 presentations will provide a clearer understanding of the state of our early childhood care and education system, and also the impacts on our families, providers, and communities when we don't have capacity at the state level in order to be able to fulfill that demand. After that, and I know Elliot will introduce this team as well, but we also wanted to put it in, I guess, more real world terms, right? It's one thing to talk about funding formulas. Oftentimes we have to remind ourselves what we are dealing with are real people who are facing real consequences of having to make very important decisions. And so after Jenna and Daphna, we're going to hear from a panel of stakeholders, a parent, a provider, and an industry leader who can describe their experiences on the ground. Finally, before we jump in, just remember that we have a looming November 1st deadline for our reports. And so this is really our big opportunity to weigh in with respect to recommendations and findings. This is a really important piece of that final report. And so make sure that you're prepared to ask lots of good questions. And as always, make sure that you have your sticky notes available so that we can capture that really good information and feedback going into the final stretches. So Jenna, the floor is yours.
I was wondering which book that Delegate Bulova had brought for his filibuster that he was going to entertain us with this morning, but you are spared that, and instead will receive quite a bit of data. What Delegate Bulova didn't tell you is that we delivered this data over 4 meetings and then have compressed it all into one for your enjoyment today. But if we can go to the next slide, please. What we will be covering today is sort of very briefly the current landscape. We will talk about these 3 drivers, and I think really important to show what we have learned in Virginia over the course of the last 4 years and how that helps think about, helps predict, helps provide an approach or methodology for how do you continue to grow and strengthen your public-private early childhood care and education system. 3 key components, easy to remember: family demand, per child funding, and future economic development. We'll then talk about, in response to questions either received by the work group or that came up in the course of the General Assembly last year, what do we know about the impact of these investments and these kind of estimations on supply? What do we know about these investments and the impact of building blocks on Virginia's economy? And then how do we think about maximizing investments? And ultimately, as the delegate noted, as we're preparing this November 1 report, thinking about what are the key things that this body wants to put forward. Next slide, please. And one more, as a reminder, this Governor Youngkin, and the General Assembly have made historic investments in early childhood funding and slots. when we talk at the state of the state this year, we reflect back across 2 administrations in 2017 or so. It was a $75 million investment of state general funds in early childhood. As of this year, you see that it's northwards of $400 million. So a very significant investment aligned with parent choice that went to child care subsidy program, our vouchers, our mixed delivery program, which is Birth to 5, and private child care programs, and our Virginia preschool initiative, which is largely based in public school. As a result of those investments, you see the number of slots. So we are trying to really work very closely with the governor and General Assembly to make sure that we are funding based on parental demand, whether that's for infants or toddlers or preschoolers, in the communities where that is needed, and that has grown in response to parent choice and parent demand. If we move to the next slide, please. Where are we? And this is just an important point to level set before we kind of go into kind of how we've gotten here and what that tells us about what the key drivers are of early childhood funding. So the strengths of this system, and this came up in our very early funding formula work group conversation, we're like, well, before we go to fix something, let's make sure that we're really clear on kind of where are the strengths, what would we potentially be putting at risk, and where are the challenges, what do we need to work on? And sort of the strengths, and this is largely based to the work of this body, the governors and the General Assembly, that we are funding more slots than ever before, and most importantly, that all of the funds last year that were dedicated for early childhood went to early childhood. So we've talked in years past that we put a lot of funds, for example, towards Virginia Preschool Initiative, but we didn't use all those funds, and those reverted to state general funds while we had kids, waiting for childcare vouchers. And so for the first time, thanks to the clarity of building blocks and establishing this distinct section of the budget, all the funds were used, funds followed the child in line with parent choice, and that we made a set of shifts to provide more slots this year, including a modest increase in co-payments, reasonable time limits for job search, and reduction of chronic absenteeism. The challenges, as Delegate Bulova noted, the wait list and the friction they cause, and I'll talk a little bit about that. Parents are opting out of the workforce, as the Professor Basak will talk about. We reallocated some dollars this year, but we can't use those immediately. We also heard from our dear colleagues in Southwest Virginia about places that hadn't had historic demand because they didn't have those kind of economic engines, those economic development projects, were then stuck when they wanted to say, now we have a childcare need, but you didn't have that in the history, and our formula or approach doesn't account for that. And then we continue to sort of see this trade-off of between funds that are the childcare subsidy dollars that go towards school age, which has now grown to nearly $100 million annually, is limiting how we can sort of address our birth to 5 need and growing kind of need for infant and toddlers. So let's get into the weeds here. We move to the next slide, please. And then one more. So as we talked about what these key elements would be, and we looked at the data from the growth and kind of these investments in recent years, 3 things emerge as the things that Virginia should account for and that can be relied on to predict the need for future funding. And those 3 things, those 3 drivers, I'll go into detail on, but one is family demand. And this really looks at, and again, with a presumption that we're going to keep eligibility. So this is not universal. This is focused on kids and families sort of in need across the Commonwealth, right? While wanting to encourage work. So there's work expectations for families that are looking for full day, full year. And we have higher eligibility so that there's not a disincentive to take on promotions and earn more dollars. So that's sort of looking at who is eligible, what do they prefer, who wants to participate in the system, and kind of where are they and what are they preferring. We also need to look at the per child funding, because as we'll show that has an effect on quality, competitive compensation, and kind of supply. And then ultimately kind of talk a little bit about future economic development and the importance for accounting for that in a way that historic growth never can. So next slide, please. Let's talk about eligibility and family demand. So again, in terms of predicting parent demand and choice, what we are going to present over these next few slides is that the way in which Virginia was able to dedicate more resources in a time of surplus resources during the pandemic gave us a sort of clear data trend on how many folks would want to participate in early childhood care and education, want to return to the workforce, where is that demand growing, what are their preferred options, and what is the relationship between that demand and growth to the economy. So you have this sort of set of data over the last few years that is sort of highly accurate at predicting how much can the system grow in any given year in response to demand, what's the impact on supply, and what's the impact on workforce participation and the economy. We note that in that there's a really important sort of macro trend happening, that more kids than ever before in the Commonwealth have all available parents in the workforce, right? So even though you have slightly slower birth rates coming out of the pandemic, largely because if you were home with children, the last thing you want to do is create more children. But that there are, because even though those birth rates are lower and migration's pretty sort of constant, that because more parents are working, or that you see greater demand for early childhood care and education. If you move to the next slide, please. So this basically shows, we sort of mapped when the higher eligibility went in, when we sort of started to grow based on parental demand because we had additional resources. And what you see is year over year, kind of going back to July of 2021, is that there's sort of a flat line of growth, right? So again, there was not necessarily, we didn't set a target out. We didn't go out on July 1st of 21 and say, we want to grow by this percentage, right? We said, we know we need to encourage people to return to the workforce. We know that there's a need for childcare. We know there's a need for additional supply. Let's see how the system grows across the Commonwealth, across 120 local social services offices, 131 communities. And what we see is sort of year over year, pretty consistent growth. And as I'll show in a moment, that also aligns with developing supply, right? So as there was growth and more vouchers available, you see an accompanying growth in supply. We move to the next slide, please. You see a similar trend with mixed delivery, slightly sort of, let me explain the difference between this slide and the prior one. For childcare subsidy, you saw that growth, even when we stopped the funding and went to the wait list, kind of continued forward, right? So the wait list kind of actually followed the same trend in terms of the historical growth. You see a slightly different trend. We see sort of pretty consistent growth since 2021. Probably there's a little bit of sort of higher than expected numbers on that wait list. And so there's kind of a question there around, could the system really grow that much? Or would it be more likely if you were to follow that green line and continue to fund mixed delivery based on growth? That'd probably be a more accurate depiction. So the wait list does skew that one slightly, but still 21, 22, 23, 24, there's a sort of demonstrable sort of demonstration of growth. More slots were added, more providers agreed to come on, more families were eligible and wanted the service, more families participated in the workforce. Next slide, please. And then, as we've talked a lot with Delegate Bulova and others, like even though there was additional resources available for VPI, so really significant resources, right? We talk about leaving $20 or $30 million on the table. You did not see growth in response to that, right? VPI is growing at a pretty constant rate over time, kind of regardless of how many dollars are put forth. And so that's probably in terms of where there is demand, where there is capacity for schools to offer more experiences. We made 3-year-olds eligible. We sort of expanded eligibility slightly for VPI in terms of including kids with special needs. And you don't necessarily see like bumps in growth in response to funding levels from the General Assembly. What you actually see is about 6% growth year over year. And so if you wanted to accurately predict how to fund VPI, you would be advised to sort of look at that growth rather than any other approach. So what those 3 slides tell you and what those kind of green lines say is, because we were able to put all these resources towards early childhood, allow family choice, provide consistent information, work with the VCF and the ready regions to kind of, help families navigate these systems. You have these pretty accurate indicators of how much the system could grow in any particular year in response to parental demand, and how much sort of supply would grow as well. What we're faced with now, if we move to the next slide, is kind of these current wait lists, right? And so we stopped growing as of Nobody lost any slots, right, as we kind of came out of the pandemic, but we were not able to continue that same rate of growth. We've been able to grow in FY25 and FY26, but not at that same growth. And as a result, you had more families wanting sort of to participate in the system, and that unmet demand manifests itself in these wait lists. So right now you have about, across childcare subsidy and mixed delivery, just over 10,000 birth to 5 children on those wait lists, and about 5,000 school-age children on those wait lists. And again, this has been a pretty continual growth. There was a dramatic growth in the beginning. This body wondered, well, is that inflated? Is that real? But as we look at the course of the year, it's pretty consistent year-over-year growth that, as I said before, if we were to go back in time and have greater resources, maybe we would have seen that actually in terms of folks enrolling and supply being built in response to that. We also know, if we move to the next slide, please, that we are making the most of these dollars. So in addition to the policy shifts that we described earlier, modest increase in co-payments, making sure that families are working if they're using these full day, full year options, we saw in response to this body and just the kind of this unmet demand that early childhood attendance is improving. We're not quite back to pre-pandemic levels, but as you look at compare 21-22 and last year, you see significant improvements in Virginia Preschool Initiative. It's dropped 25%, chronic absenteeism has since 21-22, and childcare subsidy attendance has dropped nearly 40%. So more kids are attending, and we've got a little bit more work to get back to pre-pandemic norms, but across the board, this body's emphasis on absenteeism, in addition to freeing up more slots through some of those policy shifts, we've helped improve attendance. So overall, the big picture is growth is a reliable indicator of future demand and going forward. And sort of it's probably, rather than kind of setting a particular target, a percentage of population or this, like if you wanted to say what is most likely to be the kind of the unmet demand in the next year, 2 years in response to working families in the economy, using growth for VPI, mixed delivery, childcare subsidy would be the most predictive mechanism for that. All right, let's talk a moment about what we shared on per child funding. So as a reminder, if we can move forward 2 slides. We have moved, we're one of only 4 states that has moved to a cost of quality model for childcare and mixed delivery and re-benchmarking, which is kind of fundamentally the same for Virginia Preschool Initiative. This allows us to, rather than a kind of one size fits all, to set set health, safety, and learning expectations via VQB5 for publicly funded programs, and then fund the programs based on the cost that it takes to deliver quality. So this accounts for age and ratios, the amount of time, is it full day, full year? Is it sort of academic day, academic school year, compensation expectations, and other costs? There's some variation in how much actually goes out per the state kind of amount. The co-payment sort of is a reduction off the top, right? So depending on the parent co-payment affects how much the state pays. And then for VPI, there's the local match. The key thing here, we will not get too into the weeds. We want you to know this is a national model. We want you to know that this is the most highly regarded way to compensate right now, because you're enabling programs to meet expectations. But it's key to note, if we move to the next slide, it's not one size fits all. And so you have to take those graphs that I showed you before and kind of look at what the demand is, and then sort of think about what that sort of means in terms of cost by looking at the per child cost, like in what area, for what age, and what kind of preference does the parent have in order to kind of to best estimate what funding is needed. And this kind of gives you a sense of when the state pays less per child and when the state pays more per child. But all of this, you'll see, is grounded in data. And so although the state, so for example, you sort of look at the sort of higher amount per kids for childcare subsidy mixed delivery, and like, well, that's much more expensive than Virginia Preschool Initiative. But you have to remember that that's 2,800 hours a year, right, versus the 1,000 or so that for that academic year, academic day. And so while we pay overall more for childcare subsidy or mixed delivery, We do that in large part because most of the families are not your upper income families that are paying the big co-payments. These tend to be very low income working families. And so we pay more kind of per kid there. On the flip side, VPI with the local match looks less expensive to the state, but on an hour per hour basis, it's actually slightly more expensive. So really important that you take this approach rather than using the market or kind of a back of the envelope, but that you actually look at the cost to deliver quality and then you account for that. Some folks asked in the work group, well, why is childcare and early childhood so expensive? We go to the next slide, please. And this is 70% of the cost of quality is personnel. It's really important. And again, I would imagine this is this could be a college class right now. I can manage all of you, assuming you were not adults and were children. I could probably handle you unless somebody runs for the elevator. That works because, you are ostensibly third graders, not 3-year-olds. If you were 3-year-olds, I would be lost, right? If you were 3 months old, it would be dangerous, right? If there's a fire drill, only 3 of you are coming with me. So the important thing to remember, keep that in mind, okay, as you're making important decisions today. The key thing to remember is that early childhood is labor intensive and there's just no way around that. You cannot have the device take care of the baby or get the baby out if there's a fire drill, right? And so 70% of that cost is personnel, and there's just not a lot of opportunity for efficiencies or sort of reducing that. And as I'll share in the moment, even early childhood teachers are often sort of undercompensated relative to the services that they're providing. Next slide, please. So, and this gives you an example of where we're even seeing some gaps, because the question that came to the work group is, why is childcare so expensive? And in fact, we have not made investments in cost of quality for this last biennium. It was such a big investment for the state to fund all the slots that we kind of kept cost of quality at the same as it was at the beginning of the biennium. We have, though, however, made investments in our VPI teachers, right? And their kind of ECCE and K-12 counterparts. And you see the kind of, as a result of those investments on top of re-benchmarking, that blue line is K teacher wages, VPI, ECCE teacher wages, and those have incrementally gone up, gone up, gone up. They've always been more expensive, and that is in part explained by a difference in credential. But even though VQB5 applies to these educators in the same way across the state, the gap, because we've not been able to make investments, greater investments in cost of quality between where our VPI teachers, our public setting teachers, and our childcare teachers has actually grown in that period of time. And so even though it feels more expensive, and it is, because we've gone from $15 to $19, it's still significantly lower than the peers, and that gap has grown. Next slide, please. And as a result of cost of quality, what we already see is that when we are able to increase cost of quality, we have more providers that want to take public dollars. We heard this in surveys from them. We also knew that, and part of the reason that Virginia adopted cost of quality, that before we had it and we used a market rate approach, that we saw that there's a direct relationship between the state's rate and turnover and vacancies and real challenges around being able to meet the supply and the need of Virginia's working families, as well as to be able to serve more kids and ultimately address turnover and meet quality levels. And a very specific way of showing this, if we move to the next slide, is this graph, which I just showed to the Board of Education less than 20 minutes ago. But this is a really powerful piece of data that came out of the VQB5 results for last year. Let me take just a moment to explain why cost of quality matters. So this looks at within year turnover. So this is not from one year to the next, where you've heard those stats cited before in terms of turnover. This is literally looking at the fall of 2024 Virginia classrooms and then the spring of 2025, right? So it could be a 6 or month or so difference. In our public schools last year, from fall to spring, 95% of those teachers stayed. It was the same teacher in our system, in our data system for VQB5 in the fall and in the spring. And so when we think about continuity for kids, we think about using curriculum consistently over the course of that pre-K 4 year, we think about all those measures. It was very constant for our VPI programs. In sharp contrast, in centers, 31% of the teachers changed from the fall to the spring. That is just a huge amount of change within any given year. And when you think about improvement, you might train up that childcare teacher in September, but if she's gone in January, then you're sort of starting over again. And we noted that sort of this was a very significant amount of in-year turnover, and that you see some pretty stark differences in that compensation in terms of the difference between being between $17 and $18 an hour and between $28 and $32 an hour. You'll notice that the actual comp between the leavers and the stayers is not that different in childcare, but it's probably just generally that level is not enabling those centers to be able to hire competitively and sustain those educators. We also know that the teachers in the blue, whether it was in childcare or in schools, the teachers that stayed scored higher than the teachers that left. And so there is a value to keeping teachers when you think about not only what is common sense around continuity, use of curriculum, but we actually have quality results that the teachers that stayed were scoring higher in terms of teacher taught interactions. And I wish that I could say, well, it's a competitive marketplace. Next slide, please. And they're just going to another program in BQB5. And so we want to kind of create this competition. Some incredible work done by UVA and Professor Basak and others really shows that literally, if they're not staying, maybe one of them, maybe 5% of them might be going to another location in the sector, but a whopping 30% are just leaving early childhood, publicly funded early childhood care and education altogether. So we've got this real challenge around how do we get to competitive compensation to slow down that within year and year over year turnover and ultimately deliver higher quality experiences to our children. All right. So we've talked about family demand, historic growth being a great predictor of how to think about what a future need is. We talked about the importance of cost of quality. We saw some gains I'll talk about in a moment again with moving to cost of quality, but we also saw that there's a challenge if we don't update over time to reflect what it truly takes to achieve quality as measured by BQB5. The last driver, and this is really one that we heard after moving to kind of the current system, where we just historic growth does not account for future economic development. So if you move to the next slide here, what we heard as early as the summer of last year, as we went into put these wait lists into effect, was that there were just places in the state where they were opening a new hospital, opening a new plant, and they just didn't have childcare slots, right? Because they hadn't been, allocated childcare slots because they hadn't had that growth in the past. And so as we go forward, it will be important that although historic growth is highly predictive in the kind of aggregate across the state, that you also have projects happening, job growth happening, and that you would want your formula, your drivers to account for future economic development. So this is just a kind of example of how to think about it. Like, what is Jenna talking about? This is, we're not necessarily recommending this. Think of this as an example, but if you were to work in partnership with Megan and the folks of EDP and to really understand what projects are coming online, you could then kind of add new slots to your formula, right? So you could say, okay, we know that there's going to be, 30,000 jobs created the next 3 years, right? And so, this is what is FY27, this is what is FY28, and we could either sort of we could look at how many kids we thought might be, sort of how many of those employees might be parents, how many kids are birth to 5, and kind of predict that. And then we could actually add that to the jurisdictional allocation. So just a really important thing to think about. There's just no way to look back at the data for Abington and sort of say, oh, like there's going to be all this need, right, because of what ballot is doing, right? Like you just can't predict that from the past. So you have to have a mechanism for accounting for future economic development. All right. Very quickly, if we can move to impact on supply. So one of the things that came up in the work group conversations and also came up last year at the General Assembly was, well, if we fund it, will they build it? And we went back and looked at the data and tried to answer that question. If we can move to the next slide here. What we saw that although we had a significant drop in childcare subsidy supply, so this is looking at how many providers, that's the blue line that you see across the screen, and then the light blue is the capacity, right? How many kids could those providers serve? You see that that drops during the pandemic, and then as the state said, we will grow in response to parental demand, even though there were not direct initiatives to sort of build supply, right? We've talked about we've not had kind of capital funds available, but still funding more vouchers at a competitive rate led to 500 more childcare subsidy providers coming on board. That's an increase of 21%. And across all of those childcare providers, an increased capacity of more than 30,000 children. So without doing anything directly to build supply, just funding more vouchers in response to real parent demand, right? Working parent demand, and at a cost of quality, help drive increases in supply. And next slide, please. We saw that this was not just about like more new providers, but two things were going on at once. We had more providers willing to take public dollars and serve kids with vouchers, and the average number of kids with vouchers who were being served went up. So it's really important to note that it was both those things, more childcare providers and more childcare kids per provider. We also looked, and this was again us just putting the numbers forth for the work group, at what happened when after we put the wait list in effect on July 1st of 2024. And what we saw is even in 1 year of having a wait list, that average number of childcare subsidy kids per provider dropped. So grew and grew and grew as you had more vouchers and kind of a competitive rate per voucher. You stop the sort of growth of vouchers, and boom, all of a sudden you have a dip in supply in terms of the capacity and the average authorizations per provider. We then said, okay, well, is that true across the board? Maybe that's big programs. Maybe this sort of data is skewed by particular regions. As you see, it is a consistent pattern across every region in the state, right? So you think about big childcare, small childcare, urban childcare, rural childcare. It's all represented there with the kind of the grand total going from, again, an average of 8 kids per childcare subsidy provider, sort of voucher children per provider in June of 21, up to sort of 14. So near doubling in terms of folks being willing to take public dollars. And then you also see that it holds true for family day homes as well. If we move to the next slide. So really important, you see for family day homes, our smaller programs, a very similar pattern. No direct investments in this space, but year over year growth in the number of family childcare programs willing to take childcare subsidy in that capacity. And then similarly, a little bit of drop once you put the wait list into effect. I should also note that Virginia was recently recognized for supporting growth and sort of volume of family childcare while it's gone down in the rest of the country. All right. As we move to the next slides, we're going to talk about investments on the economy. So 2 really important slides here. Basically, we asked the team to go back and look at workforce participation and the growth of as we grew the number of publicly funded early childhood slots. So this is inclusive of childcare subsidy, mixed delivery, and BPI. And what you see over time is as we grew early childhood slots in response to parental demand, workforce participation increased at a pretty steady rate, particularly in that continued growth from FY23 to FY24. At the moment we put in place the wait list, you start to see a drop in workforce participation. It makes sense, right? More options for working families, more families willing to take work, fewer options as a result of the wait list, and you start to see some drop in that workforce participation. The same, if we move to the next slide, holds true for enrollment and unemployment. So again, we had historic unemployment. As a result of the pandemic, we made lots of investments to get folks back into the workforce. That worked. We saw, year over year drop in unemployment. We put the wait list into effect, and you see a slight tick up in unemployment. And I will not steal Professor Balsek's findings, but you'll sort of see that it has a lot to do with what's happening with these wait lists. All right. And then just as a reminder, we've updated this slide, but just when you think about why this is happening, it's because folks are having to make a choice between essential in-person work and being able to take care of these children. The vast majority of the jobs that folks with childcare vouchers are working at are in-person essential work that cannot be done remotely, and really sort of supports our schools, our local government, our healthcare systems, our retail, and a wide array of other in-person kind of work. Right. Last but not least, and I want to wrap us up here, but just want to kind of put 3 other data slides in front of you to think about how we come together to think about what future need might look like based on parental demand and cost of quality, how to account for economic development, and then how to maximize every resource. So a couple of key points here. One is, thanks to the work of this body, we modestly increased co-payments up to 5% of household income this year. That is still below the federal recommendation of 7%. And we, as we think about these trade-offs between how much families are contributing, I want to note that families are contributing still much less than the full cost of care, right? So you go from like, yes, $4,000 is a lot, but it's much less than $15,000 or $17,000 or even what the state is paying in terms of $12,000. So just a reminder that if we even went a little further and up to 7% of income, we could serve another $1,700 children with the same amount of funding. So really kind of putting those trade-offs back on the table as we think about how do we not only predict what is needed, but maximize those resources. We also wanted to share this stat around prioritizing birth to 5. And so what we have seen, even though this body has noted that birth to 5 needs to be the priority, and what that pie graph shows is kind of the different ages, we still have a significant number of 9, 10, 11-year-olds whose families are participating in child care subsidy program. And those slots are now costing more than ever before. So we were $62 million in 22, and we're now up to $105 million a year going towards school-age children, which then means that you cannot serve as many birth to 5 children as you want. So again, and there are far more other resources for out-of-school time for school age than there may be for infants and toddlers. And last but not least, as we discussed really extensively at our prior meeting, we want to be thinking about all potential sources of funding. If we can move to our last slide, please. And really thinking about how do we engage philanthropy, employers. So Virginia is working, thanks to an innovative federal grant, to develop a new digital wallet that will come online this year. We hope to have visuals of it for folks by December, but basically enable employers, philanthropy, local governments to contribute towards particular children in the system. Parents can direct the dollars towards the child care program. Providers on the back end can, monitor the flow of dollars and reflect services. And it just makes it easier as you think about how do we all work together to fund this growing demand based coming from working families. This will be the technology that will at least make some of those innovations possible. And now I will turn it over to Professor Ozak.
Thank you so much for letting me follow that up. This is a super related presentation, but what I'll be sharing today is more from the perspective of the actual parents who are on the wait list and how that experience is impacting them. So on the next slide, I have a little bit of information about the survey that we did, and this was a partnership with VDOE and VECF to try to understand what happens to families when they are waiting for a child care subsidy. So the sample for this survey was about 19,000 families who had been on the wait list sometime in the past year. And we did this in a very time crunched way. And these results that I'm going to show you are extremely recent in that, as you can see, the survey, the results I'm going to show you are through September 29th, and we are still getting paper surveys back from families now. So these aren't the final results, but they are fresh results to share with you because it's really relevant to the conversation today. And we basically invited any of the families who had been on the wait list to participate. And we heard, it says 6,500, but we've heard from 7,000 of them now about their experiences being on the survey. So about now 40% of families participated from all over the state. The response rates were really similar sort of in all our communities. And the really interesting thing that gives a lot of insight in this presentation is that by the time they took the survey, 2/3 of the families were still waiting on a subsidy, but 1/3 had received the subsidy. And we wrote the survey in a way where if you were still waiting, we asked you what waiting was doing to you and your family and your employment and your children. But if you had gotten the subsidy, we asked you to reflect on what changed once you got the subsidy. So I'll share both of those pieces with you. And the goal was really, like Jenna was saying, to understand sort of opportunity costs. So what happens for the adults in the home and the children in the home when they are not able to access the subsidy? And that's what we asked families about. Okay, next slide. These are a little probably small and hard to read, but I wanted to give you a sense of who the families were that took the survey. And they look extremely similar to the full population of people we tried to survey. So that was lucky. We didn't see differences in the response rates by different kinds of families. You'll see that the vast majorities are very low income, under 150% of the federal poverty line. They have kids in that whole range, but we have about half the kids who responded are infants less than 1 year, 1 year, or 2 years. So lots of very young children, and we kind of look to see if the results differed by the age of your children. And then as far as the demographics of the kids, quite diverse. About half the families who responded were Black, 11% Hispanic, and another quarter of the families were white. About 1/3 of them had a high school degree or less. So that kind of gives you a sense of who the children were. And notably, about 15% of them reported that they thought their child had a disability. And that comes into some of the written response that parents wrote in about what the impact was, which was a really common theme, was talking about kids with developmental delays and what they either hoped a child care center could do for their child or what it was doing if they got off the wait list. So that is the overall sample. And on the next slide, I won't go into this in too much depth, but I just wanted to show you that there aren't huge differences between the people who were on the wait list and the ones that got off the wait list. So that when I show you what happened to them, which is quite different, I want to suggest that while we're not sure that the one and only driving force is a subsidy, the groups are really similar. The main difference between them, we have some regional differences in where people were able to get off the wait list, but not huge. And we have some age differences where people who had younger kids were more likely to get off the wait list than those that didn't. But as far as their poverty rates, their racial composition, their education levels, they look incredibly similar. And so these are groups of families who wanted a subsidy. Some got off, some didn't. And I'll show you kind of what that led to in their lives. Okay. I'm going to sort of break this up into two chunks, one around the economic impacts around employment, going to school, hours worked, promotions, things you could be doing as far as the parents and their work. And then in the back end of the presentation, I'll share some of what parents shared about the impacts for their children. And these are totally preliminary for now. We did this last week and this week, so they are brand new, but I think they're incredibly powerful results that sort of are more striking than I had anticipated going into this work, and so I hope they're helpful to you as you think about next steps. Okay. Next slide. The first thing we wanted to show you is what happened when we asked parents, what did you have to do while you were on the wait list as far as work or hours worked, whether you worked, all those kinds of things. So the first bar is saying, while you've been on the wait list, has any of this happened to an adult in the home? And the first bar is they worked less than they wanted to work. And you can see that nearly 80% of the parents on the wait list said they were working less than they wanted to be working specifically because of the subsidy. Very similar, 71% said they turned down additional work or a promotion because they couldn't make it work with their childcare needs. 2/3 said they reduced work or school hours to provide care, moved from full-time to part-time or even less. And then that last bar shows that 50% of the parents reported that somebody in their household had to leave a job altogether in order to care for their child. So really striking evidence about kind of the employment effect. And then in the next slide, we said, what do you think would happen if you got the subsidy? How likely is this that it would increase your work or school hours? And you can see those dark blue are the percentage of families that it's very likely this would increase my work or school hours. That's about 2/3 of families, and another quarter said it's pretty likely, somewhat likely. So most families are saying, yes, if I got the subsidy, it would increase my work hours. If I got it, it would increase the likelihood I could either accept a promotion or take a new job. And finally, you have 55% of families saying it is very likely that if I got the subsidy, I would start working. And keep those statistics in mind. We also asked those questions for the families who got the subsidy. We said, did you start working? Did you take more hours? And you'll see they line up really well. Parents really report that once they got the subsidy, they were able to go into the workforce in ways that just were not feasible when they were waiting. Okay, next slide. I will say that we gave parents an opportunity to write about what happened to them, and we have thousands and thousands of these quotes. And I thought I had done a really good job of narrowing it down to about 15 of these, which the ECF told me was an inappropriately large number of quotes to have you read today. So there's only so this is like a really small fraction of the quotes that I thought were extremely interesting, but there are lots more if people are interested. The first one is about loads of people writing about how they could not work due to their childcare challenges. I had to quit my job at USPS because my child's daycare opens later than the time I was scheduled for work, and that created conflict between me and my manager. It became financially impossible for me to keep her in daycare. I had to pull her out of daycare and quit my job to stay at home with her. So lots and lots of quotes about people that just could not stay employed because either something like this or they just had nowhere at all to leave their child in the first place. There are many families who had never used a childcare setting. They'd always taken care of their child and they're looking to work but can't find any solution for their kids. Okay, next slide. The next set of comments, of which there was also very many, was about families who passed up jobs, opportunities, or promotions because they couldn't get the childcare subsidy. I'm essentially stuck in a role that has limited growth opportunities without me having more flexible availability. If I had reliable, better, more affordable childcare, I could take a promotion to the next position up and be able to earn more money while my children are learning and growing, developing social skills with their peers, versus them sitting at home on the couch watching TV for 8 hours because grandma is tired and can only do so much on her own. My husband would also be able to go to school to become a lineman this fall. This would allow him to leave his overnight security job and secure a job as a lineman with a potential to double his yearly income within the 12 months of finishing the 3 to 4 month course. So parents were really concrete about what they wanted to do if they could get coverage. And you'll see a lot of comments that were similar to this around trying to use a family member. We heard from lots of families that said a family member was working at home and taking care of the child. Their child was safe, but their child was on devices all day long because the person taking care of them couldn't pay attention to them while working. All right, and also heard a lot from families who were trying to work towards degrees or credentials of various kinds and couldn't do it without subsidy. I worry that for the second year, I will have to withdraw from school and be a stay-at-home mom. The day-to-day anxiety leaves me on edge and nervous. I feel like I can't commit to any plans or ideas about the future months or year until I know if my daughter can go to daycare because we simply cannot afford rates without subsidy. So just 3 quotes among truly thousands of parents saying these same things. Okay, now let me show you what the parents who got off the wait list said. So this is the third of families who were able to get off the subsidies. This is, I think, the most striking of the results from the survey, aside from the many interesting quotes. We asked families, is there anybody in your household right now who wants to be working but is unemployed because of childcare? And a really staggering 40% of the families who were waiting for a wait list said that somebody in their household currently was unemployed, wanting to work, and couldn't because of childcare. That's an incredibly high unemployment rate. And you can see that's the blue bars. The gray bars are among the third of families who did receive the subsidy. And there you see that half that rate, still high, still 20% of families, but half that rate said that there was an unemployed adult in the home that couldn't work because of childcare issues. So really having the likelihood of subsidy, and that's keeping in mind that some of these families only received the subsidy very recently. So I think it understates how powerful the subsidies can be for families as far as finding work. Of the families, we asked similar questions about those ones that I showed you before for the families who are waiting for the subsidies. Could you increase your hours? Could you start working? Can you accept a promotion? 63% of families who were in the group that received the subsidies said that one of those things, at least one of those things, had happened to a person in their household. They started working, they took more hours, they're going to school more. So the vast majority are reporting sort of economic impacts. And here we're saying we asked families just about the more kind of core financial challenges that families face, especially families in poverty. So that first one, it was around, are you experiencing food insecurity? Are you worried that you're going to run out of money before you're paid? Your bills are past due. You are using credit cards because you don't have any other way to pay for resources. And the main thing to note that across all these patterns that are common for families with low incomes, there is a substantial drop once family gets the subsidy and the likelihood that they are suffering through these challenges. So a few of the more uplifting quotes from the families who got off the wait list. Peace of mind has been the biggest impact since receiving childcare assistance. While I was on the wait list, my entire paycheck was going towards paying for childcare. Since receiving childcare assistance, I'm able to work more hours without worrying about my daughter's safety or security. I've been able to get a raise and have been able to contribute to my job and my community and my family. Another one, receiving childcare assistance has had a tremendously positive impact on my family. It has relieved a significant financial burden, allowing me to focus on work and school without constantly worrying about how to afford quality care for my child. Knowing that my child is in a safe, nurturing environment while I pursue my goals has given me peace of mind and stability. This support has helped me stay on track with my education and career plans, ultimately allowing me to provide a better future for my family. Okay, so I think quite sort of compelling evidence, both from their words, but also from those reported unemployment rates about what the subsidy was able to do for families as far as employment and work support. And then I just wanted to share a little bit of the findings of what they said the wait list was doing as far as their children's development. Okay. So the most interesting, or maybe this is obvious, but a striking thing that the child care subsidies did for families is change how children were cared for. So this is just a figure saying what kind of care was your child experiencing in the last month. Those first two bars are the likelihood that the child would be in a child care center. So among the people who are waiting for the subsidy, about a quarter of them somehow managed to get into some sort of childcare center and send their child. That increases quite a bit, as you would expect when you got a childcare subsidy. So 64% of the families who got a subsidy said my child is in a childcare center. That kind of makes sense. We see very little difference in the family childcare home providers. So the biggest increase is really around getting kids into a childcare center. But what's interesting is sort of what changes. And you can see a really big drop in the likelihood that the child has no care arrangement and is fully in the care of their parents. So that's the middle bars where it says none, parent or guardian care only. If you're waiting for a wait list, 50% of those families are reporting that they themselves or their partner are taking care of the child full time and they're receiving no care. And that drops 20 percentage points for the families who got the subsidy. So really increasing the likelihood of a parent getting their time freed up, but also a child getting into a center-based program. Okay. If we ask them how hard is it to pay for childcare, not surprisingly, there is a huge drop in the likelihood you're reporting it is very hard, since the subsidy helps quite a bit. So that dark blue is the percentage of parents that is saying it is very hard to pay for our childcare right now. That is 62% of parents. And if you add in the ones that say it is somewhat hard, it's basically all parents on the wait list are saying it is hard for us with childcare. That drops quite a bit for the families who got off the wait list. You can see that only a quarter of those parents continue to say it's very hard to deal with the payments for childcare. Most families are saying it's somewhat hard, but now about a quarter of families saying you have relieved that altogether. That is no longer hard for our families. And here's, we asked families about their worries, about what they are concerned about for their children. And so we said, are you worried that your child is missing out right now on better support for their learning and their development? As you can see, the vast majority of parents on the wait list, 70% of them said that that is a worry for them, that their child's missing out on learning opportunities. And in that next set of columns, over half of them are saying, I am worried that the site is not safe for my child. Once they get the childcare subsidy, those worries significantly dissipate. Less than 20% of the parents are saying that they're concerned about their children's learning, or they're concerned about safety, suggesting that the subsidies make a big difference for how comfortable parents feel about the safety as well as the learning opportunities once their kids get into care. And just a few more statements from families. These are from families who are worried and waiting for childcare on the wait list. Not having childcare assistance has impacted both our finances and our child's development. My son is turning 2 years old and is not yet talking or interacting with other children. Without access to affordable quality care, he is missing vital opportunities for socialization and early learning that could support his development. At the same time, paying for private care is a financial strain, taking a large portion of our income and limiting our ability to provide other essentials for our family. And similarly, my child is currently being cared for by someone I don't fully trust, and quite honestly, I'm not sure it's very safe, but it's all that I can currently afford and continue to keep my job. I'm currently cutting my hours to keep one child after school while the other is in daycare. I'm struggling to make payments for just that daycare for one, but ideally they'd both be in daycare and at a safe learning facility versus the current one. And then just one last one from a family who did receive the wait list, and then I will wrap up. Receiving childcare assistance has been a blessing to my daughter. I am grateful to know she has been taken care of, and all of her teachers are helping her with her development and learning. I am able to work more hours because of childcare assistance. I will forever be grateful for this program. Okay, so to wrap up, these are brand new findings. We're hoping to put them out sort of more broadly, but you are getting to see them first today. And I think the key takeaways are that families that don't have access to childcare subsidies or are waiting for it are significantly impacted as far as both their economic well-being and their children's development. We didn't include a lot here, but a lot of parents wrote about children who had autism or had significant delays, really needed support, and were not able to get it until they received the subsidy, and that helped them quite a bit. For those families who got off the wait list, we see immediate, very fast changes, both for their children and for the family functioning as far as economic hardship. So I'll stop there. Thank you.
Yes, so in fact, before we get into
question
questions, just want to say, please wait until I get to you with the mic, because I know we can all hear each other in the room, but I want to make sure that folks participating online can hear everybody, and where the microphone coverage is, we know there are some dead spots. So if you have a question, please raise your hand. I'll bring over the mic. Megan, I've got you, and then John, and then Representative Bulova. And then if anyone online has any questions, please put them in the chat and Rebecca will flag them.
Great. Well, this is a fantastic, both your presentations were fantastic. I have so many questions, which I can ask offline, you know, I do. But for the last presentation, two questions I had was, you mentioned like food insecurity. Did you ask any questions about, are they on additional social assistance or social benefits and what programs? And then my second question is around, did you disaggregate the data by family size? So when you talked about, is there an adult that's unemployed, would this include if there's two parents or one parent? And then did you break it up by that?
Those are two good points. We have not looked at the findings yet by family size. A lot of the families are single parent as far as what we just like the adults in the home is one adult in the home, but we haven't looked to see how different it is for families that had two adults in the home. And to your other question, we didn't ask about other supports, but we should be able to link it to data on other supports. So we got our contact list from the subsidy wait list, and so that is connectable and we could see. So I'm curious what your thought is about kind of like, are you interested in whether use of other supports drops once the subsidy comes in?
No, I think it's just thinking about the value proposition that if we put, take people off the waiting list, we invest more in early childhood, they get a job. And so then we're not paying for any social assistance. And so there's a huge linkage to that. So looking at where we invest money and where do we actually save money is really important.
That's a great point.
I'm chuckling, Megan. I actually wrote that question down ahead of time. So I'll follow up on it. We see this with the nursing home attendants. We see it with direct service personnel for IDD services. I just heard a statistic for the latter that 40% of them nationwide are receiving Medicaid services. So when we look at saving money as a Commonwealth, we're looking at what's happening with SNAP right now, with WIC, with housing subsidies, and with Medicaid, and not just the wait list folks, but the actual teachers, the TAs especially. You could ask the same question about both of them.
We have done that. We do have a lot of information about the social supports used by early childhood educators, which is quite high. Most early childhood teachers working in childcare centers are using social supports of some kind or are in poverty themselves. And so I think that logic of kind of, if we put more into the cost of quality calculation, if that goes into the teachers, then you can imagine that leading to improvements in their financial well-being and save costs that way as well.
Yeah, thank you very much. That absolutely amazing body of work that you've developed together. And I feel a little bit guilty asking a question, given that I was on the work group and had 4 meetings to do this. But 3 really quick questions. I guess the first comes to kind of that cost model. And so we know the drivers. We know that we want to keep the legislation relatively broad without getting too prescriptive. I imagine then that we would translate some of this into a cost model that would have data that would go into an Excel workbook. And then, I also saw in there, that this is also part art rather than science. And so Jenna, can you speak a little bit to kind of that point, which is how much of this is purely data driven in an Excel spreadsheet? And then how much is somebody like yourself or another professional saying, how am I going to adjust this data, for something that the spreadsheet can't tell us. It takes a human being to do that.
So on the first one, for the cost of quality, our experience and what we think the data from Virginia for the last few years since we put it in place suggests that you would want kind of that methodology, and that it is really important, although we shared aggregate trends, that $20 an hour is potentially in some areas of the state a more competitive kind of compensation, right? And maybe is not at all in other areas of the state. And so if you're thinking around you sort of 70% of the cost here is related to compensation, really looking at what it takes to provide competitive compensation, accounting for parent choice, ratios, right? Sort of full day, full year is really important. We could explain the factors, and we have some explainers on cost of quality, but that is probably more science than art. And really important to note that getting that right is key, because it's not just about, more and more and more, or kind of one universal rate, right, for compensation. It's about really looking at what age, what expectations. We do that now by kind of pegging it to the K-12 salary, but taking a discount because they're not required to have the license, right? And you see quite a bit of variation, but that's probably the most equivalent, like, competitive profession. And so that is what we would highly recommend, while also accounting for differences in kind of local real estate costs, et cetera. So that is more of the science. Where I think the state has sort of had some discretion is sort of, to what extent do you want to kind of fund the growth, how much economic development, and then do you want to sort of take a portion of cost of quality? So historically, when we first ran the numbers for cost of quality, it was such a big jump that we moved to roughly 75% of cost of quality for childcare subsidy, 100% of cost of quality for mixed delivery. We took that to providers. They felt like that could work for them. We talked to childcare providers, we talked to VCF. We went to family childcare. They said that's not enough. We really need more to actually be able to pay ourselves. And UVA had data from kind of the worst periods of the pandemic, and where upwards of half of family childcare was going without salary, right? And then we're again back to that cycle, relying on public assistance just to feed themselves as childcare, family day home providers. So we went up to 100% of cost of quality there. So you want to run cost of quality like a science, right? To sort of understand kind of what those numbers are. You then might have to make some discretion based on the available funding. And then the other place where there's discretion is sort of how much can parents contribute, right? And so if you think about what Daphne just shared, we do make it affordable, right? And we're trying to we increase co-payments a little bit more, right? Even though that's hard for some families, it's certainly just so much better than the extreme hardness that families who are on the wait list are getting. So I'd say that kind of how you get the overall numbers is a science. How you sort of set some of these policies and think about, how much to contribute of that is more of an art.
And I guess the second question I had, but both presentations in different ways touched on the very tangible economic impacts, the opportunity costs with respect to not having that childcare. And I was especially drawn to the graph, Jenna, that you had with respect to labor force participation. And maybe this is an area that we don't want to go, but I'm just curious, how close are we able to, or to being able to monetize the impacts, right? And so I think we can kind of in our heads see what those impacts look like, but I'm curious how much it would take to actually say, here are the actual dollars that it costs Virginia in economic activity, but by not having these services.
Yeah, no, that's a great question. So just sort of taking a step back, one of the really important things is, we looked at these things and whether they correlate, right? And we didn't know, even going into looking at this data, whether there would be a relationship. You watch Daphne's presentation, you're like, well, it makes sense, right? When you hear about how many families are just opting out, not taking more hours, quitting jobs, or, quitting school in response to not getting it. And so it's correlational, right, in terms of what we're showing, but to sort of see that close match over time when there are, the extraordinary event was the pandemic, right? And that sort of forced a whole bunch of families out of work, mostly working moms. Like, I think Virginia was like 38th in the country, right? Really sort of real significant challenges around losing working moms from the workforce. You put more investments, you give full choice, right? We sort of funded there was no limits on BPI, mixed delivery, or childcare subsidy, and it grew and grew and grew. And you saw workforce participation grow and unemployment grow. And then you have this wait list, right? This sort of external event. And then you see that change there. So it's very strong correlation. I think, Daphne's study shows that this is what was happening for a lot of families. We had some initial work from Virginia Tech that sort of suggests that upwards of you got voucher, really increasing your rate of likelihood of working. We had work from the Prenatal Institute at Vanderbilt, right, that showed even in that 1 year, 2023, sort of really significant return on investment. And this is just economic, right? Not even thinking about kind of the kid impact. Some of that is related to GDP and their sort of taxes and earnings. Some of that is related to less reliance on public assistance. all of it, we know from other studies, suggests that, parents who opt out of the workforce don't just pay for it in the immediate, but down the road in terms of their kind of future earnings. And so they estimated, although there was a positive return on investment in that year to the tune of 60 or 50 or 60 million, that it was like, 400 plus million on that 300 million if you looked at longitudinal outcomes. And so I think we've been in conversations, with the foundation about continuing to have Vanderbilt come back and look at that again, because I think it's really compelling. We can say this is the return on investment in, on the Virginia dollars and the Virginia families and the Virginia kids.
I have a question about the federal child care subsidy in fiscal year 25 on chart number 4 from Jenna's presentation. It said it was $199 million, but for fiscal year 26, only 158 million. Yet we're going to increase our expense with state money. Can you just elaborate? Was that part of the federal budget? When was that decided?
Yeah, so that is and the 25 number, I believe, reflects some of the state and local relief funding. So it's not all of so there's still a little bit of COVID in there. Yeah.
So there was not an actual cut other than COVID
No,
funding.
so in fact, the number to think about going forward is the 158. That is sort of the steady child care and development block grant.
And just while we're on the topic, in President Trump's proposed budget for next fiscal year, did that maintain or was it cut?
It was maintained.
Great,
Yeah.
Thank you.
Yeah.
Jenna, thank you. This question goes back to your presentation when you were talking about capacity. One of the things we keep hearing about higher ed is this enrollment cliff is coming because people are having less children. I know the pandemic helped that because people were bored and stayed home and had more kids. But is there a point where we're going to see a cliff that we're creating all this capacity that we're going to reach saturation and maybe even see a decline in need for the care that we're creating?
Yeah, no, that's a great question, Delegate Terry. So I would say if you reflect back on the 4 years where we have had this growth and then we've sort of not had this or been able to support this growth, what it suggests that these things move together. And so when we put, the marketplace does respond. When you make the vouchers competitive and valuable enough for families to opt into work, right, and to participate, and it makes it sort of attractive enough for the private market to say, yes, I'll take childcare programs, right, and again, more of them, and they were serving more kids. You see kind of incremental growth in supply. So, as you think back to those 2 charts I showed on supply, it was incremental, right, in response to that. That makes sense, right? You're not taking on too much risk. I'm not opening 6 new buildings and then facing down, how am I going to fill those buildings? It was sort of, systematic, and again, without any direct capital investments, that we're making. The promise and the stability of those vouchers, provided there are enough of them and they are funded at a sort of valuable enough rate, we think was the driver of supply. And it was true for large centers, and that was true for family childcare across a whole bunch of settings. That's why we would recommend, rather than a particular target per se, sort of say you grow at the rate of growth. If you start to see, right, as the base gets bigger, that sort of rate of growth slowing down, we've seen a little bit of that in BPI, then you would sort of in the next biennium, like adjust downward, right? So it's sort of, you're not kind of saying, oh, we want to serve this percentage or we want that. We're basically saying, let's grow. Let's sort of put a prediction out there that predicts growth. Like, let's see how much it grows. Let's look at that rate of growth. And that's use that each biennium to kind of predict what is needed. And therefore, as you started to see that slowing, where you ultimately do hit, right, some parents do want to stay home, right? You do have, sort of, there's only but so many children born in Virginia each year. Then you would be able to kind of get there kind of at an incremental rate rather than sort of all of a sudden, building too much supply and having kind of empty classrooms.
If I could actually build on Delegate Terry's question and throw in a dose of what Delegate Bulova was asking about, because as you look at sort of the growth trends and how you account for that in a formula, you also then have the economic development piece that you talked about. And if I'm understanding that correctly, that's in part because whatever your sort of predictive growth trend formula is going to say, it's not going to predict sort of extraordinary events. and that there is a lag. So there's a lag in picking up those kids, and that to the point of Daphna's survey, that lag can have colossal impacts, right, on families. And so you want to get ahead of it. And that it's possible there may be more art than science in some of those, because different projects are going to bring in different kinds of workforces, but that it's important to have that in the formula so that the formula isn't trailing by a couple of years what's actually happening on the ground.
Absolutely. That's exactly right. So when we talk about the challenge around what we've learned in the last year, and again, you know, to Senator Evans' point, like the state came up and made historic investments, right? I mean, unbelievable sort of investments, you know, and nobody lost their slot, right? Which is certainly not true what is happening across the country. On the other hand, Virginia's economy is booming, right? And there are more and more parents who want to work, right? Including kind of solo parents, including two-family households, right? And as Daphna showed, these are not high income families. I think we have that higher income cutoff so that we don't have work disincentives, right? So that there's not this huge cliff the second you get above, you know, earning $30,000 a year. And still the families that we're talking about are very low income working families. What we heard from Southwest Virginia, just to use Travis, you know, as an example, is like you'd have, you know, Ballard would open a new clinic, right? And they would sort of say, we have a bunch of nurses who are all young parents, young, and, you know, and sort of in young households. And we now have the ability to open a center, right? Or we can sort of expand, we can add sort of 2 classrooms to this center. What would have to happen, because our county has already used its allocation when we sort of froze as of June 30th, is we have to sort of open the center, get the families, tell them to kind of pay full price and get on that wait list and then wait to do it. It's that friction, right? And that's just a challenge, right? Because you just can't open a center on that. And so they end up friend, family, neighbor, and being kind of concerned about that. I think similarly, we saw, thanks to Senator Locke and Delegate Bulova's bill, this ability to move dollars around. And that's important within the year, right? In any given year, we might get it slightly off. And if that's true, I don't want to leave $10 million on the table if we've got demand over here. So we took the dollars that were not used by VPI and created 1,300 slots, but that still is in the second half of the year. And still you've got sort of those families that we could only move up so many, right? When we moved, I mean, the good news of that survey is we did move a lot of families off wait list into work last year, but it is just, it is sort of costly in terms of the time that takes, sort of families opting out of the workforce. I think, you know, the point that Daphna made about even families who've gotten the voucher, it takes a little time to get back in the workforce, right? These are not easy switching costs in terms of securing care, securing employment, securing the transportation to make it to employment. And so it's that friction that if you could get it more accurate in your prediction of growth, that you would reduce a lot of that friction and sort of then lead to more workforce participation and economic development.
All right, a couple quick things. First of all, if anyone online has any questions, please do put them in the chat and Rebecca will read them. Second of all, I like talking to Jenna as much as anybody, but if people have questions for Daphna, please throw those in too. And third of all, Jenna, even before you mentioned Travis, he had already put his hand up to jump in. So Travis, the floor is yours.
Thank you. Well, the question is on the data in regard to, I think there was 20% that were receiving the support that still noted the difficulty. Are you able to dive deeper into that 20%? Because I know as this commission, we've done a lot of exploration of what is the number? Is it 5%? Is it 7% of household income? So of that 20% that still says it's difficult, I'm just curious if we can look further into who those folks are and what level they're at. That may help us spot check our math a little.
Yeah, we haven't yet, but we had that question as well. And I think one of our hypotheses is around siblings. So there are people who are waiting for another child and that's some of what people wrote about. So some of the people that got off the wait list said, I'm still waiting for this, or so they are actually waiting on childcare for another child. But I think you're saying more of like, what are their financial concerns, or why is that happening? And I think we could break that down. And the other thing I was going to say is we did ask all these families, what job did you have to, like, what industry did you have to leave? What kind of role did you have? We haven't gotten into it in the week that we've been in the data, but we're interested in that piece of it. And also for those people who got new jobs, we asked them, what industry did you get into and what kinds of jobs? So I think it'll be interesting to see what kinds of job those families are in that were in the 20%.
I mean, if you think back, for example, to that employer list, you know, some of that is gig work where you can come in and out. I don't know about you all, but, you know, getting a job with USPS, TSA, you know, local government or state government, if you leave that job, it takes, you know, 2 to 3 months at a minimum, right, to get back in if that job still exists. So I think there is going to be, a, you know, although the sort of the commonality is these are all in-person essential jobs, some of those jobs are much easier to sort of opt in and opt out of in terms of working in hours than other ones. And I just know that we were all surprised when we first analyzed this on how much government work was in there. And it is not easy to sort of come in and come out of government work.
The other thing we want to do is connect all the data to just unemployment data and workforce data for the state. So, you know, right now we're hearing from the third of the parents who answered this survey, but we can take all the waitlist data and connect it to unemployment data. And I think that would answer some of the questions you all had about and to some of these social support programs so that you could really say what happens to families in the year after they get off the wait list and what costs are you saving from that. So I think we could really quantify that. That's going to take a little bit more time, but I think having those numbers would help a lot.
Well, we've got another meeting in December. So.
Excellent. We'll get right on it.
Any other questions? We've got a couple more minutes if folks have things they want to ask.
So Kayla asked if, and I believe this is in reference to families that would be still looking for work or trying to find work opportunities, if there are referrals made to Virginia Works as far as cross-agency collaboration to help them.
Yeah, that's a great question. So this is the child care subsidy program kind of numbers we're talking about in specific in terms of these unemployment and the waitlist survey. So each of the families that are participating in the child care subsidy program, they have an individual who works with them. So we talked about kind of absenteeism, right? That we are charging their caseworkers with making sure that kids are attending, and that when you participate in child care subsidy in Virginia, it means that you do have a caseworker and they are connecting to other resources through, and I don't see the commissioner here, but through our 120 local social services offices.
Any other final questions?
It's a comment, not a question. Hope that's okay. I just want to say thank you to you both and to the team at VDOE. It is extraordinary to have this kind of data to be informing decisions. And so that takes investment in data systems and the time and the skills to be able to use it. And Daphne, thank you for ending on a positive quote. The ones with need for killing me. But also why it's so important to include those is because listening to the voices of Virginians is how we're going to change things. Mm-hmm. And I'm sure that everyone in this room had the experience I did of listening to those and being able to relate to them. The one about grandma, my husband says we fired my mom because she wasn't reliable at that time during a crisis. And all of us can speak to it, you know, no matter what our economic situation, because as someone told me when I was young with small babies, not a single other issue will bring an adult to their knees than not having access to quality childcare. So thank you. You all are changing access to quality care. And I just want to thank the teams that you both represent.
Let me add my thanks before we move on to the next portion of the program. So Jenna and Daphne, thank you so much for an outstanding presentation. And Daphne, are you still going to be around for a little while? All right, great. And Jenna clearly will be too. So if people have additional questions, then feel free to, grab them at some point during lunch, perhaps. All right, we are going to move into our next agenda item, and I'm going to try to make sure I get the details right here. So we are going to have a panel of folks responding to the information we've just learned, which will help put this into greater context with perspectives from a parent, a provider, and a business. You already heard some voices from Virginians embedded in Daphne's presentation, but now we're going to hear some more. So we've got Kayla Brewer, who's a parent from Chesapeake, Virginia, and a member of the Ready Region Family Council.
We've got Dr. Jennifer Parrish, the Executive Director of Peak Childhood Center, which has sites in Hampton and Newport News. And then we have Tommy Herbert, the Director of Government Affairs for the Virginia Restaurant, Lodging, and Travel Association, the state association representing the hospitality industry and relevant employers. As you listen, we want you to jot down your responses to some prompts on sticky notes, which you will be using for discussion after the panel presents. So let me give you the questions, and I think there's a slide that we will be able to post while you're over lunch that you can take a look at. So the questions are: first, based on what you heard from the presentation and the panel, what are 1 to 3 things that stand out to you? What is most important to you as Virginia considers how to sustainably and effectively fund early childhood going forward? Secondly, think back to our shared values that we've developed as a commission. Which aspects of these promising financial strategies or approaches most closely align with our shared values, and why? From your perspective, how should Virginia manage these potentially challenging trade-offs, right? There are limited resources. How are we going to, in keeping with our values, manage those resources most effectively? And of course, if you have any additional questions or concerns, we want to hear those too. So again, we will have this slide up for you while you are, discussing over lunch. But as you go into the panel, please take a look at them, because obviously we want to have our panelists on screen while they are talking. So with that, I will invite Kayla Brewer to get us started. Kayla, I know we saw you a minute ago.
Sorry, it was freezing for me. Good morning. My name is Kayla Brewer, and I live in Chesapeake, Virginia. I'm a married mother of a 4-year-old child with autism. I'm also a licensed K-12 educator, and I previously taught full-time for 5 years. When our son was born, we were blessed to be able to self-fund a 12-month maternity leave, like a full calendar school year. And we had seen the cost of newborn care and heard of the years-long wait list from my prior coworkers. So we were hoping to bypass those challenges by starting our child as an infant moving to toddler, but we were wrong. As we started our search for childcare, we learned that we live in a childcare desert, meaning there are more children in need of care than there are available childcare spots. The cost of the available spots we did find was also prohibitive. A center in Chesapeake, which is where we live, or a center in Virginia Beach, which is where I would work, was about 1/3 of my take-home teacher pay. By this point, we were out of options and we were out of money. So we joined every wait list in our area vicinity. But by the time a spot became available, our son had just turned 2. So it meant that he aged out of that available childcare spot, and we need to be moved to a different age range wait list at that same childcare location. It was also around this time that we noticed Kylo, our son, was not reaching his age-based developmental milestones. We began working with the local Chesapeake Infant and Toddler Connection, who referred us for professional testing at CHKD. And when he was 2.5, we learned that he had autism level 2 and was non-speaking. So this added another layer to our childcare search. I reached out to Childcare Aware Virginia. You can go onto their website and they'll send you a list of potential providers when you put in the criteria that you need. And one by one, I contacted the centers, and one by one, they all told me they could not accommodate our son's special needs. By this time, Kylo was 3 years old, and for many of the providers, being potty trained was a requirement. Despite him making good progress, it's common for children with autism to need more time and support to fully master that skill. Initially, I felt insulted that my special child was not seen as worthy of quality care. It was pretty heart-wrenching to know that this little boy who brought our whole family so much joy was being seemingly rejected. For this reason, in hopes of sharing my voice and advocating for change, I joined my local Ready Region Family Council. They then connected me with the statewide coalition, the Virginia Promise Partnership. It was here where I was able to go to events and converse directly with childcare providers. So imagine my surprise when they told me that, contrary to my belief, they did want to include children with disabilities in their programs. They simply did not have the resources. The low pay rate often leads to a high turnover rate of childcare workers. This makes it hard for providers to staff general early childhood education classrooms, let alone create new classrooms geared towards special needs children. Children with different abilities, like my son, may require a lower child to staff ratio and staff with additional hours of training to support their needs. Our son is now 4 years old, and though he qualifies for early child special education through our school district here in Chesapeake, it's only a 3-hour half-a-day program. He still requires care for the remainder of my would-be workday. As a classroom teacher, I would need to be at my school from before the school day starts around 8 a.m. until after it ends around 4 p.m. Due to not having the needed care, I work reduced hours as a substitute teacher. When I'm on these campuses, I am frequently stopped by people that saw my VPP childcare ad, and they share their own story about how they too struggled to secure childcare, be it early childcare or before and after care. Thank you for allowing me to share my lived experience, including the conversations I had with some childcare providers. My hope is that my voice creates a path for all children, including those like my son Kylo, to gain access to high quality, affordable childcare. Thank you.
Kayla, thank you so much. Does anyone have any questions for Kayla? Thank you. People were starting to applaud, so I don't want to, I'm sorry if I cut that off, but. All right, next up is Jennifer Parrish. Jennifer?
Yes, thank you for allowing me to join you this morning. I know that I've talked to many of you before, spoken at meetings, but I just want a little reminder and context that I'm with Peak Childhood Center, and we are a nonprofit, and we have 2 centers now with the one in Newport News, which just opened in June. We do participate in the subsidy program, the mixed delivery program, and then for our families who are not in those 2 programs, they go on our sliding scale. With 2 centers running now, we have to raise at least $1 million a year, and we're getting that from private funders, businesses, corporations, and foundations. And that's what really helps us to continue to get our programs running at this point. What those private funds have to do is pay the difference between the cost of running a quality program and what we receive from the state as part of the subsidy program and the family's copay. So because we're receiving 75% of the true cost of a quality program, when we have subsidy funds, we need to raise that other 25% because we don't push that back on our families. With those families who are not in those 2 programs go on our sliding scale, and this includes families who are currently on the subsidy wait list because we are bringing them in to the center with the hopes that they will soon get off the wait list and be able to partake in the subsidy program. But just to give you an idea of what our sliding scale looks like, for families living below 100% of the poverty line, they pay just $40 a week, which is less than $2,000 a year, which, as you know, is well below the true cost. A family living between 301 and 350% of the federal poverty line, they pay the equivalent of $7,260 a year. So again, well below the true cost. So we have to do quite a bit of fundraising to offset their low tuition rates. And again, it's really important to recognize we have families who are on that subsidy wait list here. And so it's really important for us to get those families off that wait list and hopefully diminish the wait list that our families are experiencing in the areas. In terms of the fundraising that we do, in the $1 million that we raise, we fundamentally get that money through giving societies. So in those instances, those folks are committing to paying us a set amount annually for 5 years. This enables us to sustain our programs for the next 5 years. So we know that we've got the funds coming in so we can do that. And so we need to ensure that the state can do that for us when it comes to subsidy and mixed delivery funding as well. I do want to make a note that we're not at full capacity at either school. Part of this is obviously the staffing issue, but another part of it is because of the concerns we have about the impact the federal budget will have on the state budget. So we do hope that in the spring that we'll be able to open five additional classrooms especially in this new building, but unless we know we've got sustainable funding, we'll be unable to do so. I know I don't really need to mention it, but I do want to say that our biggest cost issue too remains the issue of compensation. We're trying to increase it to get with greater parity with public school teachers, but we simply find it hard to do so because of the compensation issues. And now we're actually competing with public schools for the very same people. We do need to receive the true cost of quality education for families who are eligible for subsidy, and we need to know that there's a funding formula in place that will ensure the funds for ECCE are sustainable for the years to come. We are doing it through our fundraising model. I would like to see the state do it through its funding model. Because I think it's just unrealistic to ask centers to open more classrooms and provide greater access if we're not sure that we're going to have the funds that we need to do to support those in the coming years. It would be a big challenge to our families if we open classrooms and then have to suddenly close them because of a decrease in the funding that we need to maintain it. I do want to just a reminder say I am a retired school division superintendent, and in that role was very well aware of the fact that public schools also consistently needed funding, but they did have consistency in knowing where their funds were coming from in terms of, the division's LCI and the funds required to support the SOQs. Those were calculated through formulas. So we knew what to anticipate would be coming through that state funding. In addition, the K through 12 funding is benchmarked or re-benchmarked every 2 years. So the state is able to address the markets or economic conditions at the time. So we really need to do the same thing for early childhood education and care, is we need that funding formula so we know what it's based on and that we know we'll be able to receive that through the coming years, but also have the opportunity to have that re-benchmark just like K-12. So the funding is more aligned with what's happening in the economy and any other changes that are out there. So I want to thank you again for allowing me to speak with you. It's certainly exciting to be in the early childhood space right now. We're really moving forward and doing amazing things, but we're not going to be able to continue doing that unless we get that sustainable funding and know that it will essentially be re-benchmarked at some regular point in time.
Jennifer, thank you so much. Does anyone have any questions for Jennifer? All right. And then finally, on this panel, appreciate Tommy Herbert being with us. Tommy?
Good morning, and thank you so much for having me on with these great panelists. I will say that Ms. Brewer's comments sound quite a lot like what some of our members and their employees have been going through, and I do want to point out that we appreciate what Ms. Parrish and her group and other groups like them are doing. It really is necessary work in the space. My name, again, is Tommy Herbert. I'm the Director of Government Affairs here at the Virginia Restaurant, Lodging, and Travel Association. In addition, I'm actually a parent of a 1- and a 3-year-old, and I am still trying to get access to reliable childcare. So I am very, very, I'm glad that we're all here talking about this, because a lot of these stories and the quotes that were shown prior to the panel hit very close to home with me. We're lucky that my wife and I are lucky that our jobs offer us some ability to work from home, but the people in our industries, unfortunately, often do not get that luxury. Virginia is experiencing a very good growth rate in tourism-related spending, although that is happening at the same time that costs are rising on the back end for our industries. And how that relates to childcare is this: our industries are some of the most labor-intensive industries related to our sales in the entire country of all industries, and the issue of childcare is often cited by folks who we either have already employed or are attempting to employ as a barrier to being able to, to work as much or to work at all. Some of our employees in various parts of our sector are subsidy eligible. A great amount, in addition to them, are not and are simply victims of the supply crisis here in the childcare sector that's pushing costs higher. I would say that many of our industries are very good and very well thought of for the flexibility in scheduling that we are able to offer folks in many cases to who might have issues with childcare. But as we try to develop those employees, because we're absolutely adamant that our industries are not just a job, they're a career, we have issues moving folks into management positions for precisely the reason that that would impact the flexibility of their scheduling. And of course, that will impact the amount of childcare that they are requiring. And so this is a very important sort of choking factor in the further development of tourism businesses in the Commonwealth. And I would point out that this is not just a small or just a big business problem. It affects both differently, but very, very saliently. I mean, especially when you're looking for large corporate operations to bring locations into the Commonwealth. I'm sure as some of you might have been coming down 95 this morning, you may have seen the very big Kalahari development that's going up right next to 95 in Spotsylvania. They are going to be bringing in many employees in addition to employing many locals. And those people, many of them, are parents. So Kalahari, for example, cares a lot about childcare availability around their facility because it affects their ability to staff up and then, of course, to do business in what are two very, restaurants and hotels, two businesses that have extremely high input costs and sort of thin margins when you get down into the cost balance sheet. And so again, just cannot overstate how important the availability of childcare is in our business. It is, due to the nature of what we do, not really fiscally possible for our employees to take sort of long dedicated leave in order to provide childcare or in order to find it. And so the difference between an availability and not an availability can not only mean the difference between one employee or two employees, but the difference between viability and non-viability for some of our restaurants and our hotels, excuse me. And in the context of small restaurants, for example, this is really, really salient because, again, our industries are incredibly labor intensive and have incredibly thin margins. And so we are constantly on the lookout for folks to be able to help our businesses run. And many of those folks are either not able to or are not able to work as much as they would like because they are stuck. I shouldn't say stuck, because they are attending to their core responsibility of raising their children. I'm sorry, I don't mean to sound ungrateful, everyone. But it is absolutely a business issue, and it is absolutely affecting especially hospitality businesses as we are trying to grow, as we are trying to develop, as costs are rising on the back end. We are absolutely struggling with the availability of childcare in the Commonwealth, and we're so grateful for the work of the Commission, of VECF, VBREE, and grateful to try and be part of the solution on this. That's really all I have today. I'm certainly happy to answer any questions if anyone has them.
Thank you. Does anyone have any questions for Tommy?
Hey, Tommy, this is David Bulova. Good to see you.
Good to see you, sir.
So I had a quick question, and this is something that we had struggled with last year and, got into different iterations of the budget, ultimately didn't make it through. But you had mentioned, that childcare is a business issue. You also mentioned Kalahari, which I'm excited to pass every time I come down to Richmond and on the way back, and can't wait for it to open up. But you pointed out that if they can't find labor, they can't make a profit. You also mentioned something very important, that typically, hospitality runs on relatively tight margins. But one of the areas, that we're looking at is, how do you foster these public-private partnerships where you can get businesses to put in some amount of resources that are matched by the state. Then the employee puts them in, but basically to stretch our dollars out as far as possible. I didn't know if you had any particular thoughts on the feasibility or viability of that coming from the hospitality industry.
I think that would certainly be a conversation that my members would want to have. It is all in our industry. Not only do we face a sort of a workforce issue in moving folks and getting folks in, but we also compete for the same labor. And so I view the idea of a given business childhood subsidy as something that would be incredibly persuasive to folks who are seeking a career in the hospitality industries. That, you know, for example, if you're working at Great Wolf and you can't quite find childcare, you can't quite afford childcare, and Kalahari comes along suddenly and says, oh, by the way, we can provide you a stipend or something along those lines. I think that you would see folks practically running up 64 to get to 95 to try and apply, because it is again, so many of our employees are parents. It's not an age restrictive industry, I suppose, is what you would say in our workforce calculus.
Thank you.
Any other questions? All right. Tommy, thank you again. I really appreciate your taking the time to be with us here today. Speaking of the restaurant industry, it's almost lunchtime. That's I know you're all looking forward to it. So let me give you your instructions. We are going to reconvene at 1, and folks who are participating remotely will be put in a breakout room. But this is a working lunch. So if folks can pick up their lunches and then come back to table discussion, you see the prompts up on the screen. So by all means, to make reference to them. So again, we ask you to take a moment to sort of come up with your own answers to those, and then talk about those at your table. And we will be asking each of the groups to report out. So if you want to designate someone to do that report out when we reconvene promptly at 1 o'clock, that would be great. And if anyone has any questions, I know I'll be around, and others from the VECF and VDE teams are around as well if anyone needs anything. Anything that folks want to ask about for the good of the group before we let everyone pick up their food? Didn't think so. So please enjoy your lunch, and we will see you back here at 1. So again, the questions are, based on what you heard from the presentation and the panel, what are 1 to 3 things that stand out to you? What is most important to you as Virginia considers how to sustainably and effectively fund early childhood going forward? Think back to our shared values. Which aspects of these promising financing strategies or approaches most closely align with our shared values, and why? From your perspective, how should Virginia manage these potentially challenging trade-offs with limited resources? And any additional questions or concerns that you might have. All right, green table.
So the questions led to more questions. Ultimately, I believe the area that we focused in on is in regard to the economic development arena. And when we think about site selectors, bringing new jobs to the Commonwealth, how are we positioned and ready for infrastructure, not just water, sewer, roads, but the critical infrastructure of early care and education. And so our questions have been around who understands the need first, who understands not just the readiness of the site in that gas rail transportation arena, but who understands the readiness of the community and the child care arena, but also who leads the charge when that takes place as well. And then what types of investment or incentive is there to address that from the locality or the state's perspective? How do you finance and bring those resources in to kind of address that need when we're thinking about job creation and retention as well?
So then it seems like there were a lot of sort of how questions, right? Like it wasn't like you weren't debating whether or not it was a good idea. You were saying like basically like it is a good idea. Let's figure out how to do it correctly, which is great. All right, red table.
Just continuing on that theme a little bit. When you start looking at when you provide more providers, people use them. And so that makes it more of a zero-sum game. Usually when you're trying to figure out budgets like in the General Assembly, it's all a zero-sum game. You know, if we take something from here, we have to bring it back over here to make up for it. And in this case, going on what you just said too, just not only is supply meeting the demand, but we know those kids that are with those parents, those kids that are in care, are going to cost us less money through their whole careers. There's data we saw yesterday that, you know, there's a direct correlation between absenteeism in preschool and absenteeism in middle school. There was a Harvard professor that was involved with Head Start that he wanted to be able to say that failure in pre-K has a direct correlation to failure in high school and dropping out of high school and other bad outcomes. So I think while we're thinking about this, it's just a very, very smart thing to do, and it's going to be win-win for everybody involved. Okay,
I guess something that jumped out as we were listening to the first panelist was she mentioned her situation being in a desert. And I just kind of, again, a question that came out is everything that this commission is doing and what's coming out of it, how is it addressing that desert situation? It's addressing a lot of things, but is there something that's going to make somebody want to step in and start providing this service in a desert? So just kind of a question.
It is a good question, one which VDE is about to offer some thoughts on.
Absolutely. So thank you, Kevin. So I think as we look again at this period of time, this 4 years in Virginia, and look at the sort of the two essential shifts being offering the kind of the three different programs, Virginia Preschool Initiative, Child Care Subsidy, and Mixed Delivery, making two changes to those programs, which is to make more of them available, sort of based on demand, right? So say you can grow and grow and grow. We made a few more folks eligible. We made 3-year-olds eligible for VPI. We raised that income cutoff for child care subsidy, and gave a little bit of flexibility on mixed delivery and VPI eligibility, but still the vast majority of our families are very low income. And then for those three programs, moved to a competitive cost-based approach, right? So that had more value for the family, which reduced what they would have to pay and made it affordable and made it more attractive for the private provider. That we think is the most important thing to do to address deserts, right? Because then it sort of allows more providers to participate in childcare subsidy, rely on those dollars. There's a direct relationship between community wealth and deserts, right? Where there are working families who have resources, childcare centers can come in and grow, and that needs no government stimulation. If you look at sort of the wealthiest zip codes in Virginia, you might see very little of our presence there, right? Some may opt into VQB5, they may take a handful of scholarship or voucher children, but they can afford to charge $400 a week and parents can pay, right? And sort of, when you see the really sort of newer, fancier programs like that, that's sort of that there is sort of sufficient supply. The difference maker, if you would look at our research and UVA's research around folks where otherwise parents cannot pay, then you're going to have a desert, right? Because a desert is a function of how many kids you have and how much those households can afford to pay. And so by making more childcare subsidy vouchers, more mixed delivery slots, more VPI slots available, we saw this huge uptick, much more uptick on childcare subsidy and mixed delivery than we saw in preschool. And then we saw that supply grow, and it was more providers opening. It was more providers who existed agreeing to take childcare subsidy, right? And that allowed them to bring in more revenues. Some of the research that Daphne did showed that, for a while in the pandemic, you had open childcare subsidy programs that weren't filling every spot, right? So that was a problem in terms of either families weren't working or there weren't enough vouchers. We helped solve for that. And so you have new operators, existing operators that are taking more kids, and then kind of really importantly that sort of that number of voucher kids per program opened. That sort of then gives you a confidence that, okay, now like this center is full, it's functioning, it's got a bunch of vouchers, I'm going to open a center down the street. And so we think it's really important that you get the rates right and you allow the growth. I think the one place where we saw that not working is what we described in sort of Southwest Virginia and other places where there was a
explicit economic development project, in a place that was a desert, right? Because that's been a sort of a challenge in terms of supply in Southwest Virginia, although we saw some of that growth in Southwest Virginia. And in that case, there's just not a way to kind of account for what is a sort of a more sudden influx of need. And that's where you'd have to kind of account for it. But we do think that our evidence shows that the increasing the number of vouchers and making the vouchers more valuable in a cost-based way did help reduce some of the deserts. There's just a lot more room to grow.
All right, now we will hear from the blue team.
Okay, so we talked about the importance of, first of all, ensuring that the state all understand that the economic impact, obviously, that childcare has, that it's not just a nice to have, that it really does, like Jenna was just saying, that the economic impact is felt throughout the state. The UVA and the VDOE reports, we thought, showed the causation and the causality. And we were trying to, talk about and think about, how do you monetize that? How do you monetize that? And again, show the people that are making the big decisions that, the money is needed for childcare. Demonstrate the stability of the monies and the funding for those like Jennifer who are unable to open those classrooms because of that uncertainty. So we thought that was very important. Another thing, and Jenna was just talking about the desert. We talked a little bit about how special ed in childcare, children with special needs, that also is a desert, because while there may be plenty of childcare and maybe even childcare slots, a lot of centers are not adapted for special ed and for those children. So, taking that into account as well. And then we also just talked about how important it is to, again, looking at the UVA and BDOE reports, take the qualitative and the quantitative information and kind of use that to impact our decisions.
Thank you. And Erica, I actually think there's a broader point to the point you raised about special ed, because, we've been talking about expansion of slots, and that's important, right? Because there's a lot of families for whom a sort of quote unquote standard slot in a childcare center is an incredibly useful asset. But as we've talked about at other times, there are some people who work unusual schedules or have children with unusual needs. And that as we think about capacity building, some of these issues have to be part of that capacity building too, right? And making sure that it's not just a sort of one size fits all approach. It's like, how are we actually meeting the needs of children and families? Let us get a report out from the folks online.
I feel like our group was kind of on par with everyone else. With what you're saying about sustainability is hinging on diversifying the funding beyond the state general funds to include those stable public and private partnerships and innovative ideas for funding. Prioritizing family demand-driven allocation, so using those wait lists to reallocate resources across the different programs. While addressing chronic absenteeism, so funds go where they will be used, regular adjustments to cost of care and paying closer to true cost of quality care, which should drive up teacher wages, not just with providers that accept public dollars, but across the industry. We did have a couple questions. One was, how will Virginia track the long-term return on investment of these strategies on kindergarten readiness and economic productivity, especially amid federal policy shifts? And then also, what is currently available for those communities that are looking for those public-private partnerships? Like, how can they engage with those in their local communities and bringing it to a more local, isolated level? And then To kind of go off of the special ed, is there a way that when there is VQB5 rating, that if a child care provider does offer those special ed or specialty care, it could be a possible listed on the VQB5. Maybe that's a way that parents could find high quality, but then also a center that could assist their child and their needs.
Absolutely. Thanks.
Jenna, would you mind coming up to the front?
Oh, comes from, yeah, sure. Oh, all right. So, okay, Kayla, let me, John threw me for a second. So a couple of points there. So the first is, how are we thinking about tracking return on investment? And so there's a couple of different ways to do that. And we will continue to work with Vanderbilt and the Prenatal to 3 Institute to think about kind of quantitatively how we estimate that. Equally important, this fall, we fully launched, this summer fall, we fully launched VA Connects. And this is a nation-leading data system that actually captures what children are experiencing across, so in our early childhood system right now for last year, there were 3,293 sites, and they represent 11,300 classrooms, right? So a very big system that kind of all those vouchers and dollars and slots that I was talking about earlier go to. We have worked very closely with UVA, VCF, the Ready Regions as part of VQB5 to not only thinking about measuring quality year over year and putting that information at fingertips, but to actually understand kind of how those experiences and some of the factors that are different at the classroom level then affect kids' growth and learning over time, which is, ultimately kind of all of our sort of true north here. So what VA Connects does is it creates the kind of, it links Link B5, which captures that data. So it says these kids are in this classroom, right? As an infant, toddler, a preschooler. This is the curriculum used. This is the credential of the educator. This is the compensation of the educator. And you think about what I showed you earlier. This is sort of what we know about that classroom. It then connects that, whether they're as a toddler, as a preschooler, once they have BKRP data or that kindergarten readiness data. So we know at the beginning, the middle and end is when they're 3-year-olds, then they're 4-year-olds, then they come into kindergarten, and all 90,000 kindergartners in Virginia system are evaluated in the fall and the spring on BKRP. And then it connects to VALS, which is the new PALS, which is the language and literacy screener. So we went from having these separate systems and being able kind of to match kids to now saying, as of last year, for the 132,000 kids across the system, we'll know what experiences they have, and then we'll know how much they grew on BKRP, whether they come in kindergarten ready and all the way through. And because of how we set up the system, we can match them backwards and we can have their state testing identifiers. So all the way through all their SOLs through high school, and then to link up with the Virginia longitudinal data system. So what that means at scale is for 130,000 kids last year, and then sort of adding more and more and more, the whole VA Connects covers about 800,000 kids that will be able to, really track how much these experiences relate to to children's growing over time, their kindergarten readiness and beyond. And that'll be really important in addition to the kind of workforce measures. When Daphne was first preparing that presentation, we were all only talking about workforce measures. And then she said, hey, you're not going to believe what the parents are also saying about the learning. And so that's why we asked her to add that additional content. And so we will be able to not only economically sort of track impact, but also track kids over time. And again, we think this is the only sort of data system of its kind at this scale, with all of that kind of classroom experience data. Yes, John.
Once you start tracking the kindergarten, do you continue to follow them?
Yeah.
Oh, great.
Yeah. So that you have what's called a state testing identifier that sticks with you all the way through. And what we can't assign that identifier to you as a toddler, but we can, the second you enter a public school, we can do it, and then we can back map it. So it's way more complicated than I can explain in terms of beyond that, but it will help us really not only understand the impact on kids, but to sort of really think differently about how much we're growing kids, right? Because we know that our kids who are in our least resource households might come even into pre-K less ready, right? And less prepared. And so we will be able to not only tell you what's the sort of impact in terms of, are they ready or not, but even how much programs grew them. And we'll tie in attendance tracking to that this year as well. And so, how much participation then leads to these better outcomes. Yes, Travis, do you have a question?
I would say over the numerous years of being in this conversation, I believe we're at a really good point because now we're not trying to prove the importance. I think we're all on board, and mathematically we now see how it impacts labor force. What we don't yet have is the ROI, but I think it's there. I think we'll get every bit of our investment back. I guess the other thing that I've been thinking about is, so how do we find that right amount? The right amount to get that we want to project. And then we talked a little bit about, well, what if the enrollment or the population dips a little? But we also need to think about the economic development. So if we land big companies, there's got to be a pool or resource there. The things that I've also been thinking about is, I don't know if the localities at the local governmental levels are on the same page yet. So I think the faster we can get the ROI determined, the more the localities could understand a little bit about that. And here's why I think it's important. In the public school arena, we do per pupil funding. The locality has to have a match. We don't do that in early education. And if we think about, well, what's the amount of investment? If we go from the 5% to the 7% cost share, $21 million of accessibility, right? Without any more money, just changing 2%. So are there other ways to think creatively? I'm not sure that every locality can come up with a per pupil match in addition to what they do for K-12, but is there an incentive for that? And when I think about BPI, and looking at some of the attendance rates there versus the private, it's not full day care sometime. And so I wonder if you get better attendance rates because you might be getting better labor force participation among the private providers than the public providers. I think that's worth digging into and thinking about a little more as well. And then I think in the special education arena, wonder if there's a way to consider a formula and true cost of care for maybe a higher rate of reimbursable for those individuals needing that assistance. And I believe K-12 has greater, more accessible facilities, and they're better positioned. Not saying that we want all special education children not to be in the private sector, but I think if the investment was there, whether it was private or public, that might be able to help a little more in expanding those services. Because ultimately in the private sector, there's the business model. And the more localities we see in rural communities, they can't afford that cost of care because they don't have the big paying jobs. In Northern Virginia, they can charge what they want to. They can meet that demand because the pay is there. In rural localities, that's not. In their business model, when BPI takes 3 and 4 year olds, that takes profitability away from the private sector. That then is why they don't cover the infants and the toddlers, which also makes a complex problem. So I think working closer with school systems, we need to figure out what that happy formula and mix is, especially in the rural communities.
Yeah, no, that's a great point, Travis. And just sort of to respond to our remote folks, 2 other questions. So we think it is important to engage localities. I would say, one of the things that we've been talking a lot about in last week, I know the secretary mentioned this in her opening comments, is making sure that folks are even aware of their local VQB5 results and their honor rolls, right? And that there are these real bright spots in terms of overall achievement, infant toddler quality, right, in a way that is obviously not located in public schools, and improvement, and thinking about, if you look at those honor rolls, you'll see that it's way more than schools, right? We are really elevating family childcare and faith-based options, and that becomes I think, important in terms of, you think about whether it's asking localities to make an investment or just to recognize that VQB5 is in every city and county in the Commonwealth. And there are also bright spots that we want to be elevating and recognizing and sort of in thinking about, and if it's growing their capacity and or charging them to support others. I think we have heard and know from our work with UVA around the challenges that families with kids with special needs are experiencing. We have made a set of steps in that regard. We still have a lot to go. So we have made kids with special needs categorically eligible for Virginia Preschool Initiative. So school divisions are obligated by federal law to address the needs of 3 and 4-year-olds. And we sort of, Virginia went a step further and said, you can also have the wraparound services of VPI and typical preschool. In addition, we are still making some progress in that space, but still don't have enough preschool options for kids in there. We do have a special rate for childcare subsidy. We've been piloting that and pushing that out. Still, some work to be done in terms of really figuring out to what extent does that rate cover the cost. And then the other thing that I was talking with Nicholas about earlier is also just the coordination of services, so that figuring out both sort of what should childcare subsidy be paying for, and then what is covered by healthcare, health insurance, what is covered by kind of the different sources. And so that kind of really thinking through how do we continue to work with the sector to address that. And I know we've had some similar conversations with mixed delivery and trying to think through what do those rates look like? How do we address the unique needs of the kids? And then sort of in order to maximize funds, like we don't want childcare subsidy to cover something that your private health insurance or Cardinal Care would cover, right? And so that's just much more of a complicated space and one that warrants more work. But we hope, I was thinking, Kayla, as you were talking, we'll engage as we are out in the field right now doing 9 Ready Region data deep dives on the VQB5 results. One thing that we could contemplate going forward would be, a honor roll that recognized incredible work with kids with special needs, right? So a part of what we've done is we realized that it was more expensive and sometimes more challenging to offer infant and toddler care for many of the reasons that Travis just named. So that's part of why VQB5 has an infant toddler honor roll. It kind of elevates that work, which is harder and more expensive. We could go back and contemplate something similar for those programs that are doing incredible work with kids with special needs.
I recently have a new role as executive director of Virginia Access, and Virginia Access is made up of a lot of agencies that treat the kids we're talking about right now with the special needs, and adults as well. And the not so good news is it's the same workforce challenge, that we were saying earlier. And there's waiting lists and waiting slots and waiver spots in that area too. So it's really, we need to have everyone come together on it and coordinate it.
Yes, absolutely, John. Thank you so much.
Thank you, Jenna. I know we've gone a little bit over time, but people had such good comments and questions that we wanted to do that. And I will just end this segment with an observation, which is that everybody's comments were very much in the spirit of, yes, we should do this. Let's talk about how, right? Let's talk about how we make these pieces fit together. Let's talk about how we get the details right. But that the direction that this group has been going seems to have really resonated, and that the framework that you heard feels like reflective of sort of where this group's head actually is, or collective heads are. If anyone feels strongly to the contrary, now would probably be a good time to say so. But otherwise, this has been incredibly helpful in both identifying a promising direction and then fleshing out some of the work that's going to be needed to make sure that as the state moves in that direction, that it is successful in doing so and achieving all the goals that this commission has laid out. So unless anyone's going to jump up and be like, hell no, that's all wrong, I will turn it over to Delegate Bulova for our next agenda item.
All right, everybody. So we are going into the home stretch. And so I just wanted to kind of lay things out where they are in terms of our next report. I also wanted to answer the very good question that Jenna had which is before I was almost forced to filibuster, what would I have been reading? And that actually would have probably been Jabberwocky by Lewis Carroll, which is something I was forced to memorize in 12th grade English. So I can't remember what I did yesterday, but I can remember the entire Jabberwocky poem from ages ago.
I will make sure to always be on time.
There you go. So you're familiar with it. Okay. So anyways, this year we had three bills that the Senate referred to the commission, which was House Bill 1959, House Bill 1972, and House Bill 2538. The reports for those three bills are due to the Senate Clerk's Office, the Senate Finance and Appropriations Committee, and the patrons that were just referenced by those bills by November 1st. And so historically, the commission has used one of two mechanisms for looking at bills that have been referred to us. So either we can look at them in the full commission and incorporate them into our conversations, or we put together ad hoc work groups. And so what I wanted to do before we wrap up today is provide a summary of the content of the report so that we're all on the same page, because ultimately the idea is that we develop the content for the report, but we're going to pass that along to a steering committee to be able to wrap that up with a smaller group. And so wanted to make sure we had an opportunity to lay out kind of our findings, what we discussed for each of those bills, to give everybody a chance to either say, yep, that sounds about right, or raise any additional questions and concerns that ought to be captured. So just wanted to walk through each of those bills very quickly individually. So the first one is House Bill 1959. So we heard about this one during our September meeting. This was brought to us by Delegate Bennett Parker. And so what this bill would do is it proposes adding a new priority group to the child care subsidy program waitlist. And the priority would be for families with a parent who is working more than 30 hours per week in a publicly funded child care setting. And so what this does is it aims to support recruitment and retention of early childhood educators by improving their access to childcare subsidies. And so a work group on this one was put together and met on August 21st. A couple of key things that they discussed that we wanted to highlight in our report back. Low wages for these educators are a hindrance with respect to them getting into the workforce and staying in the workforce. The average salary is $17.91 per hour. Nearly half rely on some form of public assistance. So there is an issue there. Staffing shortages and high turnover impact program quantity and quality, as well as capacity. I think, you know, as we've seen several times, there is a substantial wait list of 14,000 children. I think what was not clear from the conversations would how many of those 14,000 children would actually qualify under this new priority group. So it's not clear exactly if we made this investment that it would result on this number of people getting on the wait list. And it's also not one of these increasing the number of slots. It's rearranging who is able to have full access to those slots. So in terms of what the work group offered, I think we wanted to continue to explore the fiscal and operational impacts of that. We're not sure that this is the most cost-efficient way of getting at the issue that I think that Delegate Bennett Parker has very nicely focused in on, which is how to make it possible for these individuals to provide the services that we all rely on. And so the other part that we put out there was consider focusing on other structural solutions. So rather than shifting around who might be on that priority wait list, is looking at increasing cost of quality, reimbursement rates, and other things that we've talked about today. House Bill 1972, this was brought to us by Delegate Gardner. This legislation would have amended and reenacted Section 22.1-2289.03, which all of you all know is the legislation or the bill code that establishes the unified public-private partner system for early childhood care and education. What Delegate Gardner's bill would have done would add that the system needs to be universally accessible. And then she defined universally accessible as providing each family with a child who is 3 or 4 years old of age with at least one slot. And then further, it would require a sliding scale so that certain slots would be provided at no cost or at reduced costs. So some of that ought to sound very familiar because it does align with a lot of the work that we've been doing in terms of accessibility, in terms of affordability. In terms of this one, I think where we're focusing on in terms of the report isn't on recommending that specific bill, but aligning what Delegate Gardner is trying to do with the core values that we have ultimately laid out as far as the direction of early childhood care and education in Virginia. So strategies that would support what Delegate Gardner are looking at is using family demand to drive funding decisions, expanding public-private financing mechanisms, addressing those workforce challenges, streamlining regulations to support provider sustainability, and then promoting early childhood care and education as a key economic development strategy. And then finally, the last one, this is House Bill 2538. And so this is the proposal to codify the funding formula, as we've talked about today, based on parent demand, cost per child, and economic development needs. The work group, as I had mentioned, met 4 times, and so had the following findings. Current funding does not fully account for demand, cost, or economic growth. We lack a re-benchmarking mechanism, which leads to underfunding and educator pay gaps that get bigger and bigger each year that we don't address re-benchmarking. Waitlist and unmet demand are growing, especially in childcare deserts. And then funding inconsistencies hinder long-term planning and systems stability. And I think we heard this in our table conversations. And so what the work group is recommending is codifying a funding formula aligned with commission values. So accessibility, stability, quality, and return on the investment, including elements like eligibility, parent demand, and parent choice, as well as cost of quality and economic development, and then ensuring the formula is specific enough to meet family need, yet flexible enough for administrative implementation. And then also what would be included in the report on that particular bill is the really excellent work done by UVA and done by VDOE, which I think sets out a really good case for why we need that funding formula. So a lot of information, and it reflects a multitude of perspectives that have been brought to the table. But we do rely on that steering committee in order to be able to put a bow on all this and to make it succinct and to go ahead and bring that all together. And so before we look for your approval for the steering committee to engage in that work, we just wanted to open the floor to any questions or comments or concerns about things that you want to make sure are highlighted in the report for those 3 bills that were referred to us. Yes, sir.
I think Jenna used a number. I'm sorry, you're so fast. Jenna, did you use the numbers like count on an average of 6% growth with that dance between capacity and supply? And if so, should we give that as for example, this is what we expect to happen?
I don't know why Jenna keeps trying to go back there. Just sit up here the whole time.
Poor John. So that was an example that was specific, John, to Virginia Preschool Initiative. So we actually.
No, it doesn't extrapolate.
It doesn't extrapolate to each of the 3. So we do have the rates for each of the different programs in response to the parental demand for each of those programs. But it would be important, back to Delegate Bulova's point earlier about art and science. This is where science would be needed. You would not want to just take the 6% and apply that across the board. You would want to look at mixed deliveries, growth rate. You'd want to look at the child care subsidy, in particular the birth to 5, and you want to look at BPI and calculate those separately.
Your report references that.
Yes. Yes, exactly. That, and it would do that, and it would account for that. And there's a few ways that we discussed. You could look at just the last year average. You could look at a 3-year average, but the report would enable folks to kind of consider that more broadly.
All right. Any other thoughts or comments from our commission members? Okay, hearing none. I know it's already been a robust conversation today, and it is very, very much appreciated. This is important work. This will be supporting the decisions that are made during the 2026 General Assembly session. And so it is critical that we have that feedback. We actually had 3 reports due out of this commission. So the first one was already due. Our next one on these 3 bills is coming up on November 1st. And then we have a third one that's due on December 1st for attendance requirements in school-age childcare. And because of those tight schedules, we're actually not scheduled to meet again until December 3rd. We wanted to make sure that everybody felt comfortable with respect to tasking the steering committee to be able to put those together and reflect the work of this commission. In case you're suspicious and want to know who's on that mighty steering committee. So this is Emily Ann Gullickson for Secretary Gadara, Delegate Coiner, Gary Thompson, Billy Reed on behalf of Secretary Slater, and Nicholas Palacio. So those are our all-star hitters who will get together around a table and make sure everything is in good shape. But with that, do we have a motion to approve having the steering committee put together this final report? Do I have a motion? Anybody? So moved. Do I get a second? All right. All those in favor say aye. All those opposed, nay. Geez, that's usually the funnest part of like wrapping up a meeting is like doing that. So anyways, the final thing, and this is actually something that Delegate Coiner was supposed to do in terms of wrapping up with public comments. The irony is that because of a child care issue dealing with her daughter getting out early dismissal 3 hours, she had to leave here early. So the irony was not lost on me whatsoever. But at this point, we do open up the floor for public comment. I don't have anybody signed up. But if there's anybody at the last minute who wanted to weigh in and provide comments before the commission, we would certainly welcome those. And seeing none. All right. With that, I don't know if there's anybody else who has any other good for the order. I'm not seeing any. So with that, I want to thank everybody very, very much for your hard work today. This has been extremely productive. And represents a lot of hard work on your all's behalf, but also from BDOE and a number of other stakeholders who have really put their effort into making sure that these are productive and meaningful. And with that, our final meeting for 2025 is December 3rd, and we will be back at the Reynolds Community College. So we will see you then. We are adjourned. Thank you.